Good morning, and thank you for joining us this morning at our City Council study session. We'll go ahead and get started. Ruth, could you please call the roll?
Yes, sir. Adamson?
Here.
Gray?
Here.
Brown? Johnston?
Here.
Moore?
Here.
Orr?
Here.
Platt?
Here. Thank you. Before we jump into agenda item number 2, I would just like to make the announcement that agenda item number 3 has been pulled from the agenda. Nathan Millward is stuck in, I think, Caldwell or Napa, and there's just no way to get him home on a train. They're fighting slides and all kinds of other things, and so that's been pulled from the agenda. With that, we will go to agenda item number 2 is the Construction Board of Appeals and Review update. Representatives from the Construction Board of Appeals and Review will discuss the board's goals and projects as well as council's policies and expectations.
Good morning, Mayor, Council. Len Transtrom, I'm the building official with the City of Pocatello and the staff liaison for the Construction Board of Appeals. I'm here representing that Construction Board of Appeals, and I'll provide a brief overview of the functions of the board and answer questions that you may have, as well as relay any policy adjustments or expectations that you have of that board back to the board. The purpose of the Construction Board of Appeals is to review interpretations of the building and fire codes and enforcement procedures of such codes. The board also collects data and information pertaining to building code adjustments and procedures. In other words, the Building Code Advisory Board can only make judgment calls on interpretations of the code. They can't waive any real functions of the code. If the code says thou shalt do this, they don't have the ability to overrule that. The other thing that the board has the ability to do is make rulings on fences, variances for fences in heights and locations. That's also charged to that board. The board meets on an on-call basis by the authority of the building official. Consists of 6 members representing building, plumbing, electrical, gas, mechanical trades, architecture and engineering, and fire life safety. So we have representatives from basically all of the trades that sit on that board. With the exception of fire and life safety matters, individuals may be non-residents that are on that board as long as they're licensed to practice their business within the city limits. Members are on a 2-year term, and we presently have 1 vacancy on that term. The members that are currently on that, we have a gentleman, Terry Swallow. He represents the plumbing trades. We have Richard Lehman. He represents the electrical trades. Michael Bright, he represents the general contractor trades. Ted Booth is our chair and represents the architectural/engineering trade. And Richard Nelson, retired fire personnel, he represents the fire life safety trades. And Councilman Orr is our council representative.
So that vacancy would be in what
That
trade?
vacancy is for gas mechanical trades. We still have a vacancy for that. So, are there any questions that I can answer for you as to the function of the board?
Is it very active in terms of...
You know, it really isn't. I think we had 1 board meeting last year. Again, each of these individuals have their own business that they're in, so we don't meet unless we have an item to rule on. So fences are 90% of what we do are fences, but and in my sense, that's a good deal because it shows that the judgment calls that we're making as building and fire officials are something that the people are good with. We aren't getting a lot of kickback on the judgment and interpretation calls that we make.
A couple of years ago, there was an issue with a fence over at like Cedar Street. Whatever happened to that?
That lady was required by the board to meet the standards of the fence ordinance. She then appealed that from the Board of Appeals. Let's start from the beginning of that. She submitted permits for a fence. It was denied based on not complying with the fence ordinance. She constructed the fence anyway, out of compliance with that ordinance, and then she appealed that to the Construction Board of Appeals. They denied her request. Then it came to the City Council, and the City Council denied her request for variations from the fence ordinance.
And she left it there anyway?
No, actually, that fence is right to the mark as to exactly what takes place.
Left the trees there, which she can do.
Trees are not fences, and so she kind of went a different way around screening her property, but she met the code requirements.
And I would agree, Lynn, it's nice that, at least a couple of those that I was involved in over the years, it's nice to be able to bring in that group of people and look at those issues and get that kind of sense from other than just a couple of people at the city. I think it's real helpful.
And hopefully it gives people a stop between the exact rules that are out there and the city council. So, hopefully it waives some of the stuff that could be coming directly to you folks to make decisions on.
Yeah.
Any other questions for Lynn? Thank you, Lynn.
I'll get you out of here for lunch.
Appreciate it. Agenda item number 3 was pulled from the agenda, so we will move to agenda item number 4.
Mr. Mayor, one question on that item number 3.
Yes.
Was it a proposal for a specific park? I mean, could Parks Department tell us some background? I hate to see that wait. That's such a nice project.
Well, it's a great project, but I don't want to get ahead of the central labor workers as well. And so when we spoke to Nathan this morning, he said it would be okay. We'll wait until June or July. We gave him the 2 different dates, and he said they'd be fine. So
There's nothing in the information that specifies the park. They may have one in mind, but
do you have some? Have you met with
Your permission, Mayor?
I really don't
wanna
think.
wait, okay.
Yeah, let's wait.
I just don't want us to be accused of being the obstacle.
We won't be accused
no,
of
it's
that.
UPRR.
So they'll be okay. They all understand and know what's happening. So I would hold off on that. We'll move on then to agenda item number 4 is Hope and Recovery Resource Center update. Christopher K. Daniels, representing Hope and Recovery Resource Center, will give a presentation about the center's involvement in the community and answer questions council may have regarding the center. Good morning.
Good morning. Mayor Blatt, City Council members, it's really a pleasure to be here today. My name is Chris Daniels, and I am a very grateful recovered alcoholic. I introduce myself that way because, as you see up there, Hope and Recovery Resource Center is a peer-supported, peer-directed group of people that are working to help individuals with mental health and addiction issues with their recovery. We are a 501c3 nonprofit organization. I'll talk about that in a little bit more with respect to where we fit in a statewide effort that's going on currently. We officially opened our doors July of last year. We had a ribbon cutting ceremony at the end of August, and so with respect to formal business, we really consider ourselves having opened on September 1st. We're located at 210 East Center Street in Suite D. That's the old Idaho Power Building, if you've been in Pocatello long enough to know that. I had not, but I did learn that. This picture shows our entrance from the parking lot side rather than the Center Street side, because that's the side of the building that we're located on. Our facility has a number of areas that are important to us. Our open reception area up front is really kind of a gathering place for the people that utilize our services. We have meeting rooms available where meetings such as Alcoholics Anonymous, Narcotics Anonymous, we have meditation groups that meet. We have a number of other sorts of life skills meetings that go on as well. And we have a computer resource room where we have a bank of 6 computers that are open to anybody that wishes to utilize the center's resources. A little bit of a history. Hope and Recovery is one of 8 centers around the state that, beginning in 2015, that the state funded through Millennium Fund funds. The centers are located in Coeur d'Alene, Moscow, Lewiston, Emmett, Caldwell, Boise, here in Pocatello, and Idaho Falls. That Star in Twin Falls is a center that's going to be opening very soon. They're not part of the funding process, but the success that we've had spurred them on to open up their own center independently, but they've become part of our Idaho Association of Recovery Community Centers that we formed to keep a consolidated effort in the recovery centers in the state. The Coeur d'Alene, Pocatello, and Boise centers are all part of a joint 501c3. The other centers are independent of that. But again, we all cooperate together through the association. Hope and Recovery has 3 employees. I'm executive director. Allie Toscanelli is our program director. She oversees kind of day-to-day operations and keeps things running smoothly. And Ronette Levis is our volunteer coordinator. We call her Mom. She's the one that herds the cats and keeps the kids under control. We are, again, peer-based, so that everybody that either works for the center officially, the 3 of us that are employed at the center, plus all of our volunteers, work as peers with individuals that come in through the doors. The services and the support that we provide, we do recovery coaching, which is sort of a person that works between people that are working in counseling, for instance, and then just out in the real world. We kind of provide some continuity for those individuals in a mentoring kind of situation, help them solve their problems, let them become better problem solvers, and work effectively in their recovery program. Peer support is our underlying philosophy there. We are working with IDOC. A number of our volunteers are IDOC mentors in their mentor program. So they work with people that are getting ready to be released from the prison and coming to the Pocatello area, either from the women's prison or the other men's prisons. We do a whole host of healthcare and wellness education programs and classes that go on periodically at the center. And unique to the 8 current centers around the state, we have a transportation program here in Pocatello. We own a van. We provide transportation for peers that are affiliated with the center and for referrals from outside providers in the area. We also work closely with the jail for our transportation program. Individuals that are working in the Wood Court program for their recovery program, we routinely, pretty much on a daily basis, pick up a group of those people, transport them to the center in the morning. They get out to do their job search, whatever. If they need to get to counseling, we provide them transportation to make sure that they get there. Everybody I think is probably familiar with the path from the jail to downtown among the recovery community. That walk is better known as the Walk of Shame. We provide that transportation because if you're familiar with the first business that they come to if they're walking into town, it's the Rimrock Bar. And quite often people leaving jail and trying to get into town never get past that. So we're trying to facilitate their recovery by doing that. We do treatment referral. We get people connected to treatment around the city in the local area. And we also connect people up with the current crisis centers that are available in southern Idaho. We routinely have provided transportation for people that have walked in our doors that are in crisis, drug issues, or even mental health issues. We've gotten them to Idaho Falls, to the crisis center, and we have provided transportation all the way to Twin Falls as well. As I mentioned before, we have a number of recovery support groups that meet at the center. We also have, of course, volunteer opportunities. We have a large number of projects that the people that are peers at the center can get involved in. Just this last weekend, we had a group that went to the spring cleanup and helped clean up part of Pocatello. We routinely have also on Saturdays a peer family day, so that people that are affiliated with the center can come in, they can bring their children in. We have children's movies that go on. We'll have a variety of different games and activities as well. The access to technology, I already mentioned our resource room. So people can access the internet, do job search, they can utilize the computers for things like building resumes, resume construction, etc. Exercise equipment, we do have a room that has some exercise equipment. I generally call it my frustration room. If I get frustrated, I go there and work pumping some iron for a little while, and that seems to help. As well as skills group. One of the things that we're setting up currently is a 6-week program on cooking and nutrition with the food bank. It's a 6-week series of classes where people come in, learn about nutrition for a specific meal that gets prepared that day, and through the generosity of that program, those individuals then take a sack home that has all the fixings for doing that meal at home by themselves. It's kind of a fun little project. Everything is free at the Hope and Recovery Center. We have no charges for anything. Our charge in reality is that we ask people to pay it forward. We ask for them to spend volunteer time there. Sit at the front desk and answer the phones, greet people. We have a number of volunteers that have become official drivers for the group now, so they participate in the transportation program. And in the future, we hope to be having a whole lot more going on. These are some information, this is some data from what we've been collecting. In March of this last year, we had over 850 check-ins of individuals. That may include one individual that may have come in 3 times during the day as they were out to look for work. They checked back to kind of report back their successes and let us know what's going on. In March, our transportation, we logged in 782 local miles. This last month, that jumped to 1,400. So we're doing a lot of transportation for people that don't have access or ability to other forms. We're generally averaging about 200 hours of volunteer time per month. And over 50% of the people, of the peers at the center, have criminal justice system involvement. They're involved with the jail, they're on probation. They've been released from prison on parole, and we work intensively with those people to help keep them on the straight and narrow and hopefully reduce recidivism. And we've got a pretty good success rate. Over the last month since September, we've had about 85% of our participants that remain in recovery and have not gone into relapse or other problems.
And what's your relationship with our police department?
We work with the police department. We will call them if we have issues where we may need intervention at the center. We have not been working as closely with the police department as I would like. I've only been in this position for 3 months, so I haven't gotten to everybody yet. But
Well, I guess the question leans towards, is there something that can be developed there that some of the contacts that the police make out there, they might be able to refer clients to you where they don't have any other place to refer?
Absolutely. Which actually brings us right into that next point that I wanted to make. Coming out of the Coeur d'Alene Center, they've been open now for almost 2 years. They've started doing analysis of looking what sort of successes are they having and what kind of return on the dollar investment is going on with these recovery centers. And this is just preliminary data, but what they found is that intervening in crisis situations where individuals don't have to go to the hospital, they don't end up in BHU, they come to us, they don't get busted for parole problems or probation problems because they managed to work out their issues at the center. They were seeing, at least preliminarily, $8 saved for every dollar invested. And that's not too surprising to me, actually. I want to set up a good relationship with the Pocatello Police, because when they intervene with something, it may be advantageous to just bring them to us.
And another question would be relationship with Family Service Alliance.
Yes.
Because I know the Police and Family Service Alliance have a great relationship, and many times when they're out on a call, domestic issue, they can call Family Services. They come out and help resolve that. And I'm thinking there might be I'm not sure. I think they're probably more directed toward the female participant in that, and I'm just curious if maybe there's an opportunity there for your group to.
I believe there is, absolutely, and that is one of my goals, or at least on my list of to-do things to get in place. We do have a women's trauma support group that meets a couple times a week now. That just actually began just recently. Our funding initially for our first year came from the Millennium Fund through the legislature. We have approximately 6 pathways to sustainability that we're working on right now. We're developing reimbursement-based services where we can work with local providers, primarily right now through BPA funding, to provide recovery support services that those providers don't provide to individuals that are working with them. Our relationship with them requires referral from them, so people don't just walk in our door and we find funding for them. We can't do that, at least not yet. So we've got the ability now to provide reimbursement-based services through our transportation program and a number of other options there. Through our statewide association, we're working on negotiating contracts with IDOC to help manage on a regional basis case management with the IDOC mentoring program. We're also having discussions with Optum Medicaid Service Management that we should be able to participate, particularly with Optum, with the peer support specialist program, which is kind of like the recovery coach equivalent in the mental health area. We're continuing to pursue, based on that cost savings that I just talked about, continued funding both from the state and Bannock County has been very generous. They're providing a portion of our funding for our second year. And we simply sold that on the basis that if we keep 5 people out of the BHU on a monthly basis, we can save tremendous amounts of money based on that because of the lack of funding then being pulled from the indigent services, which a lot of our people fit into. We're writing grants, both federal and state. There are a number of programs, particularly with the current opioid crisis issue. We have connections into that as well. We are kicking off a fundraising effort on June 21st of this year, coming close to our end of our first year. And we, of course, are pursuing individual donations. And we have one family that has made a very substantial donation to the center to establish an endowment so that we can have a solid funding base to keep the lights on, and then utilize our other funds to fund expansion of programs and development of other programs. So I'm very grateful to be here today, and I thank you for your time, and I'm happy to answer any questions if you have them.
Mr. Mayor?
Yes.
Chris, I've noticed that you're at all of the important meetings, like the one with the Crisis Center, the one where we're talking about the impact of heroin on our community. Would you comment in terms of why we need the Crisis Center?
Sure, I'd be happy to. Right now, the only 2 options for crisis management, particularly with situations that I've already talked about, mental health issues and substance abuse issues. Right now, it's get them to Idaho Falls or get them to Twin Falls. the local area really doesn't have many other options. The only other option is the hospital, and that's hugely expensive.
And it's full most of the time.
And it's full most of the time, absolutely. Hope and Recovery provides a piece of that puzzle. And right now, kind of what we're saying in the Recovery Center community is that, the Crisis Center, if you were here the other day, the Crisis Center in Idaho Falls can keep somebody for 23 hours and 59 minutes. After that, they have to be out the door for various issues and reasons. If they need more treatment, they have to bring them back in the front door and readmit them and go through the whole process again. So we're essentially looking from the Recovery Center point of view is that, the Crisis Center for a day, Recovery Centers for a lifetime. They can do what they need to do, but if we're not there and they walk out the door 4 days after detox and getting stabilized, they're right back in the same situation that they were before with respect to services. So I believe that we're going to play a very important role, and I think that the Crisis Center is a huge step forward for us, particularly because the recovery centers, we don't do treatment, we don't do residential treatment or anything like that, and there really isn't a lot of places for people to go, and that sucks a lot of taxpayer money for the solutions that are currently out there. So I really see these as kind of working hand in hand.
Thank you very much, Mr. Mayor.
Thank you.
Yeah, Councilman Orr?
Chris, congratulations on your sobriety.
Thank you.
That's a dragon that affects and ties many people, and so it's a tough road, and congratulations on that. Does the Crisis Center have a board of directors?
Hope and Recovery?
Or Hope and Recovery?
Yes, we do. We have a governing board of directors. As executive director, I answer directly to them. It's a 9-member board, and the members of the board are, president of our board is Mike Beers, who is Bannock County Treatment Coordinator out at the jail. Our vice president is John Rocker. He's Director of Treatment Services for Juvenile Justice here in town. Our secretary is Helen Lusk. She's a community advocate, and she's a real fireball. You don't want to get in her way when she's on a mission. Our treasurer is Bill Slavin. He's director of Lighthouse for Recovery here in town. The faith community, our representative is Jacqueline Thomas, Big Mama, as I'm sure you know her. I don't think there's anybody in town that doesn't. Let's see, Heidi Rasmussen, she is a student of alcohol and mental health treatment. She's graduating this year and will become a provider in town. Let's see, Sheriff Nielsen is on our board. Okay. So we work very intimately and closely with the jail and the Sheriff's Department. And Dr. Bob Barkus is also a member. He's a community provider. I believe he's a PA with mental health services background and addiction issues. And he works at, I think, Physicians Immediate Care, if I've got the right location. And is that 9 or is that 8?
That's close enough. But,
okay. There's somebody in there that I'm missing, and I'm embarrassed that I can't remember the person.
In your presentation here, you said there was 200 hours of volunteer time per month. Does that meet the need at the present time, or is there people that are coming in and I'm sure it's a revolving door with some.
Oh, it is. And we have people that come in and they desperately need our services. They kind of get stable in their recovery program, and we don't see them again. And that's just fine. We have a pretty solid foundation of returning volunteers that are there almost on a daily basis. In terms of our volunteer needs right now, we're doing pretty good. One of our biggest needs is consistency in having somebody at the front desk to answer the phones and greet people coming in. because any given day, the three of us that are employed there are in and out of the office all the time. So answering the phones and greeting people sometimes is multiple tasking. I didn't mention our hours. On Monday through Friday, we're open from 10 to 8. And on Saturdays, we're open from, 11 to 8. And on Saturdays, we're open 11 to 4.
Well, you came from Idaho State, it looks like you were in the College of Pharmacy up there.
I was a professor in the College of Pharmacy. I retired 5 years ago. I've been pretty much involved, prior to coming to Hope and Recovery, I've been president of the Friendship Club here in town. And we also provide support services for people in recovery. There's meetings. It's kind of a gathering place, a safe and sober environment. I got kind of pulled into this because when they were initially having the discussions about starting a recovery center here, there were a lot of people that were, I guess, concerned that we would think that they were stepping all over our toes at the Friendship Club. And it's just the opposite. We needed this in conjunction with the Friendship Club. So I was very supportive of that idea and got put on the steering committee when the idea first started getting floated. So I've been involved with that from the beginning. So I retired from the College of Pharmacy. I'm a pharmacologist by training, a scientist. Did research for over 30 years in cancer research, both in San Francisco and here at ISU once I joined ISU. When the position for executive director came available, I was acting director when we first opened the doors last July and then turned it over. When the position came available, I decided that I'd apply for the position, and because what I discovered was when I retired from the university, the only thing I retired from was a paycheck. I'm just as busy now as I ever was in my entire career before,
Absolutely.
so I figured...
Well, the reason I ask is because I mean, alcohol numbers are difficult to track, but as I've watched what's going on in Pocatello, my understanding is that heroin and use is up 62%, and some of these other drugs because of so much material coming out of Mexico. The reason I mentioned Idaho State is because as I've interacted with a lot of young people, it's amazing how many of them want to go into sociology or psychology, and there may be an opportunity to utilize some of those through the university on it, like with pharmacists. Okay, they have to go through their rotations and move around, or even here in the city, we've used ISU students to assist with certain programs. So it may be a resource for you out there to
absolutely.
add as these students start getting towards graduation, to bring them in and get them a little exposure to that. Just an idea. So.
Yeah, no, it's an excellent resource in the community, and we plan to take full advantage of it. Coming up here this fall, we're going to be having, through the College of Pharmacy, we're going to be participating in their immunization program. They do free immunizations. We're going to hopefully be able to get some of them to the center to do immunizations for people that come to the center.
Well, thank you.
Thank you very much.
Super.
Appreciate
Thank
your
you,
time.
Chris. Appreciate it. We'll move on then to agenda item 5 is RFP review benefits counseling service. Human resources staff will be available to provide a formal submission for the request of proposal RFP that was put out in April 2017 for the city's benefit and insurance consulting services. Staff is seeking council's guidance on what consulting group is preferred. Good morning.
Good morning. Heather Buchanan, HR Director.
Nicole Harms, HR Consultant. Alrighty, so I believe it was last month we informed Mayor and Council that we were sending out a request for proposal for our benefits and insurance consulting contract, which is currently with Mercer. So an overview, we've been with Mercer as our current provider for about the last 13 years. They've been doing a great job for us. It was requested by one of the council members, I believe it was or if I remember correctly, many months ago, probably last year.
Well, I get blamed for a lot of things, so.
I'm not blaming you. It was just requested that maybe it was time to see what else was out there, as we've had a long-standing contract and maybe they weren't providing as strong of services as we needed. So we put the request out there and it closed on April 14th, and it was reviewed by both HR and Council President Brown. He's not here today, so hopefully he shared his information with you, or if not, we will. So some key things that we were looking for was, one, to provide consultation on benefit and insurance matters. It is really important that as a small HR department that we have the resources to make sure we stay compliant with all the new laws and regulations, as well as provide appropriate insurance coverage for our employees. We were looking for in-house underwriting. The underwriting is basically when we get our insurance numbers, and if they're in-house, the underwriters will help reduce that increase. So it's really important that whichever consultant that we choose has in-house underwriting. We don't want them outsourcing that piece. Teledoc is something that is new this year that we requested. We talked about it when we talked about benefits, I think in March. Teledoc is the ability for an employee to speak with a doctor and receive consultation and maybe a prescription over the phone via webcam. So they don't have to leave their house. If they have multiple children with the same illness, they're only paying one consult fee. They're not infecting others, and it's just a little bit more convenient for the employee. They handle primary care, mental health, sorry, I was trying to think, pediatrics, that's what I was going for, as well as dermatologists are also on there, so if you have a rash, you can take a picture of it and send it to them. They can kind of diagnose that as well as sexual education and sex health.
So are they finding that that's pretty successful? I mean, the system's designed to accomplish that? Because I'm a believer that a lot of stuff can be done that way. So is it successful? I mean, are they contracted with physicians whose job is to make that work?
That's the idea.
Okay.
I personally have never used one that has the video feature. I've used it in California, where you can call up and they don't have that video requirement in the state of California. So you can just talk to a physician, and I've found it useful for me personally. It's a little bit different, and so it would require some education for our employees, but I think it would be really useful and reduce the amount of time that they're off work.
I agree.
The way it typically works is there's an app, so you request the appointment. The doctor then gives you a call within probably about an hour to 2 hours, and then you have the consultation. They can send the prescription to a pharmacy that's local here in town, and hopefully treatment begins almost immediately. So it can be beneficial. I just don't know if it would be used because we haven't tried it yet. So.
What would the consult fee be?
We'll talk about that when we talk about the different options. It depends on the group that we choose. Some of them have, it's covered 100% as a consult fee. Some of them do have a consult fee for the employee. Some of we have to pay per employee per month. So it just depends. The other things that we were looking for with a consulting group was the ability to be on site for meetings. So when you guys have questions, you want to talk to the experts. And so sometimes we bring Mercer in to talk to you about different updates in the insurance world. They came out and talked about the private exchange when we were exploring that option. So we do require that they can be on site for meetings if necessary. They must have a local Idaho presence. So we don't want someone out in Nebraska or New York trying to give us consult, as well as compliance capabilities. So staying compliant with programs like currently the ACA or COBRA compliance. We have ERISA and all of those other fun things that we have to stay compliant with. We received 7 formal responses to our RFP. Of course, we received a response from Mercer as our current consultant. They came in at $25,000 for an annual contract. We're currently paying $20,000 and we have for quite some time, so inflation happens, and so we're anticipating a slight increase from Mercer this year. Regardless, Arthur Gallagher and Company, they are currently our providers of our HRA Viva. So they responded with an annual cost of $50,000. Intermountain, they're doing business with Alliant Employee Benefits. Intermountain does currently our work comp, and they wanted to charge 1% of our premiums. So whatever our medical premiums would be annually, they would charge us 1%.
What were they last year?
Our medical premiums,
$6 million?
I think it was 6.5.
Okay, so that's $65,000. The Gallagher group, is that the same one that does our water studies, our utility
I
studies?
don't believe so.
His name is Gallagher. I don't know if they're the same. That was my first thought when I saw
Yeah,
it. So
I mean,
I have to check into that.
Okay, it'd be nice to find out, but okay.
The Levitt Group, which is a local group out of Idaho Falls, and they charge $7.80 per employee per month.
Per month?
Yes.
Okay.
And the Murray Group was a $54,000 annual fee. The Hayes Group is Hayes and Morton are both out of Utah, so Hayes was at $43,000, and Morton just put in their RFP that they will accept the current fee without knowing what our current fee was. So I thought that was interesting.
Brave.
I was like, oh, okay. So after review, our top options were Mercer, the Levitt Group, and Murray Group. So a basic overview of those 3 groups, you have a cost comparison. As I mentioned, the Levitt Group was $7.80 per employee per month. That's based off of those enrolled in our medical program, so that does not include fire. So that would come out to about $42,494 a year, depending on how many we actually had enroll. Mercer and the Murray Group are both out of Boise, and the Levitt Group is located, as I mentioned, in Idaho Falls. They all have underwriting in-house, which we felt was extremely important. And with the teledoc feature, they all had a different approach to teledoc. Mercer has an additional cost. So that would be $2 per employee per month on top of the $25,000 fee. And then employees, when using the program, would have a $40 consult fee, which seemed a little bit excessive as our primary care physician copay is $25. So I didn't think that the convenience of staying home for a consult outweighed the cost, personally. The Levitt Group has a really great teledoc program. It is included in their fee of the $7.80 per employee per month, and there's no consult fee. So employees can use the program absolutely free. The Murray Group has the teledoc program as well. It is an additional cost of $4.25 per employee per month on top of the $54,000 fee, but there's no consult fee for the employee. So again, it would be free for them to use.
And how come we didn't include Hayes?
Because, if I remember correctly, they didn't offer all of the services that we were interested in.
Okay, I had a conversation with President Brown at 6:35 this morning, and he indicated that there was a company that normally charged $13,000 for the teledoc, but they were willing to do it for 10, which he said came to $35,000.
I think when we did the estimates, we didn't have the exact right number of employees enrolled in our medical program. I used the 454, which is what we used for the RFP. But he is correct. So the Levitt Group usually charges $10 per employee per month for their program. And so they're charging us $7.80, and I believe $2 of that, or $2.50 of that, is strictly just for teledoc. So if you take just what they charge for the teledoc program, and I can pull that up because I brought it with me. They charge $2.65 per employee per month for the teledoc alone. So if you pulled that price out of the $780 per employee per month, their general consulting fee is competitive with Mercer's.
Now I'm confused because your graph right there says that they're charging $42,494. Over here under teledoc it says yes, included, no consult fee.
We had them build the teledoc cost into their total.
Well,
rate to us.
yeah, but again, shouldn't it say over there, yes, but it's additional cost of $2 and some odd cents of
It's built
employee?
into that 780. So the 42,494 is the 780 per employee per month times 454 employees that we estimated would be enrolled in the plan,
Okay, so if
and
the,
then times 12.
so if the employee numbers go up or down, then that number moves with it?
It would.
Yes.
But of the 780, 265 of that is the teledoc. So if you pulled that piece out of the 780 and you calculated the total annual fee without teledoc included, it would be competitive with the Mercer annual cost.
Kate, did you know if the teledoc includes specialists like orthopedic doctors that would prescribe a anti-inflammatory, let's say?
It includes just primary care physicians, but if you consulted with them and they felt like an anti-inflammatory might be appropriate, they might be able to prescribe that.
Because going to a specialist costs you a $50 copay
That's
instead of $25 copay. Okay. So there's 454 employees, right? Is that what you're telling us?
Approximately, not including fire in our medical plan. Because fire will be leaving our medical plan next fiscal year.
So that's approximately about $10,400 in copays if those employees use teledoc once a year.
Well, they wouldn't pay any copay.
Well, that's what I'm saying. That's where the savings is, because
Right.
you pay a $25 copay going to a physician.
That's one of the benefits of the Leave It
Absolutely.
group. That's one of the reasons that they made our finalist list.
Now,
is there
if I
is no cost.
go to a physician and make my copay, and they see me and prescribe a antibiotic, and then do you know how much then Aetna pays on that office visit on average?
An office visit on average can run anywhere from $100 to $250. And so if you're only paying $25 or $50, Aetna's picking up the rest of that.
Okay, so let's say Aetna's picking up $50, okay? And we do it one time for $400, there's another 20-some thousand, okay, right? 450 times $50.
This money that we put into the teledoc program could eventually save us in our experience rating. I think that's what you're getting at.
Well, that's one of it, but I'm looking at dollars saved too. So what you're saying then is if I go to a physician and have a prescription issued, pay my copay, that goes against our
Deductible.
That's experience.
That's included.
Goes
in
against
our-
my number, but I'm talking about our
Yes, it's included in our experience rating whenever
your
you walk
experience
in to
rating.
see a physician.
Okay? Have you been able to do a breakdown on our experience rating of how much of that is office visits to physicians or?
Typically, when we get our experience rating reports, they only report on the top 20 to 25 claims. So we get to see our high dollar claims. We get to see how many times total maybe the plan was used, but we don't really get to see a breakdown of the office visits. So I couldn't give you that exact number.
Okay. Well, for old people like me, I tend to do that a lot because there's a lot of bones that creak and stuff. So I think I've been to the doctor, different doctors, probably 3 times this month. Okay, with making co-pays and such. So so there's 2 things. One, experience rating, hopefully we go down. But 2, have you, based on some type of criteria, have you determined what this could save the city or the employee?
Where we don't have a teledoc system now, we have no numbers to compare that to. I mean, if you said you used it once a year, well, if you only go to the doctor once a year, that's not really a lot. If you go to the doctor a couple times a month and you use this system instead, I have no basis numbers to do a comparison or any sort of.
Right. So we got an estimate. We have to estimate. So
Do the companies that are quoting this to you, do they have any examples from other people that have used it that they can say this is what they saved or something tangible, so we have like even an idea at all, so we don't just think we're throwing money and we don't know if it's going to be used?
When the Levitt Group came and talked to us, they talked more about the savings to the employee and the reduction in time loss. So they didn't really talk in concrete dollars and they used, I believe it was either the city of Idaho Falls or the one right next to it.
Do you think they would have that if we asked them, or they just don't really collect
We
that?
can reach out. Teladoc is definitely a system that is geared toward convenience and savings for the employee. It's not necessarily a savings of what you look at for the savings to the city portion. It's the convenience to the employee. It greatly increases employees who reach out for mental health wellness. That is my main focus of running it. It's very hard for a person to walk into a therapist's office or into a counselor, but yet they can sit in their room at their home and have their first couple counseling sessions. It's the convenience for the employee. It's the lack of copay. It's not the embarrassment of having to go in for some items. That is the benefit that most of these people have pushed towards us. We can go back to them and say, hey, what is the average savings for a city? But even then, that number is going to be pretty loosey-goosey just based on everyone's
I
benefit
would still be interested
structures.
just to know what they say it is, just,
We can ask. I'm not sure what we're going to get back.
okay.
So which group was Council President Brown?
He was referring to the Levitt Group, if I remember correctly.
Because here's why I think it's important to be looking at this. As we continue to deal with increasing healthcare costs. Okay, one, our experience rating is it's a major part of that cost, or how they determine our premium, right?
Yes.
So if we can decrease that, that helps to decrease those increases. Two, having a number of nephews and nieces who are married with children and such, I can guarantee you that they're going to the doctor probably 3, 4, 5 times within the first 6 weeks of school starting, because these human petri dishes get back into the classroom and spread everything. So as we look to control those, I think it's going to be a benefit. Is it our understanding then that all of these RFPs then at least meet or exceed what Mercer was doing for us?
Yes.
Yes.
How long has Levitt been in business?
The Levitt Group has been in business for a handful of years. They were previously doing business as the American Insurance Service Group, and they joined Levitt, which is a national organization. So they do have the resources of a larger group now.
So similar to Mercer.
Very similar, but they started local. Mercer's a national organization.
Can I ask a couple of questions while I'm thinking about them here?
Sure.
It just seems to me we spend so much on healthcare. I mean, it's so extraordinary. I still feel like, particularly when we're talking about the Teladoc and all that stuff, that there's got to be some sort of an opportunity out there for an organization as big as ours that spends $6 million a year to somehow contract with a physician and have a company physician. You know, whether that's with Health West across the street or whatever that is, it still seems to me like, you know, we could hire a physician for a couple $100,000 and probably exceed what we would spend in me and him and everybody else going to other physicians. So that's one thing I think we should look at more is along that way. And the other issue is, what does our insurance company and the insurance industry do to try to reduce costs on, because basically everything that's done we pay for. I mean, if you go have a knee replaced, the insurance pays for it, we're going to pay for it the next time they change our premiums. I mean, we're paying it. The insurance company's not paying that. And I watched a story on the news the other night about the majority of total knee replacements in the United States now are extraordinary. They're really expensive, and they dish them out like candy. And this particular story talked about how a large percentage of those really aren't necessary, that there's other things that should be done before you look at a total knee replacement, but that's not how our medical society and the industry works. What does our insurance company, what does our process do to try to guide that to where we're not doing things that we shouldn't be doing? I guess is my question. Or is that goofy to even think that?
I think that our carrier, Aetna, and I know that Blue Cross did it as well, gives enough pushback to the doctors that kind of gives that checks and balance. I don't know exactly.
Do you believe that?
I do, because I've heard from employees that they're having to go through the hoops to get certain procedures done. Usually if it's not medically necessary, then an insurance group is not as willing to cover it. The idea behind insurance is that the reason why we pay more is when the costs are more than what our premiums are. So our premiums, the $6.5 million, we hope that that amount there will outweigh what everyone is using the plan for. And we have a healthy group, and then we have those that need procedures done. And so usually it kind of balances out.
Right.
And they want to see us somewhere around 80 to 90% of that. If we go over that, so if we're at 120%, for example, that's when we see the larger increases.
Sure. Okay, I've said my piece.
I have another question. So, I was just curious about Morton, where they were going to accept the current fee. Were they just saying they would basically match what Mercer's doing, and did they not include the teledoc on that? I'm just curious why, if they were going to be lower and include it.
I don't believe they included teledoc. The top
Okay.
3 that we put in here were the ones that explicitly talked to us about teledoc, and we had hard numbers.
Okay.
Some of the companies said they offer it but didn't give us a cost or if it was included or not.
So they didn't give you enough.
So they didn't meet the RFP.
They hit the minimums of it. They didn't
Oh, okay.
do some of the things that we were looking for, but were not a basic requirement.
Teledoc was one of those extra things that we were looking for. It
And
wasn't
they
one of
didn't
them.
respond to that portion of it. Okay, that's what I was wondering.
Okay.
I think it's important that, I don't think we need to weight our experience rating based on how much we don't spend by going to a doctor in terms of the city. What we're providing is a convenience for the employees. Because if we had 1,000 visits at $50 a visit, that we would save on this, for example, that's just $50,000, which seems like a lot of money, but against 6.5 million, that's an incremental percentage. Our big savings will come by getting healthier people who don't use our insurance for catastrophic events. That's where we're paying through the nose. Is every time we have a big surgery or a long convalescence or something like that, that's where we're getting hurt. Yeah, and so, yes, we will make a little dent in terms of our experience rating if we transfer this cost in another way, but the net won't be very much in terms of the experience rating. It'll be in terms of convenience to the employees. Yes. And then secondary thing I have a question about, are we talking per employee or per insured cost? Because it seems like if we're just going to be paying per employee, that's one fee. But if we've got a mother and college-age children that are covered, we could get a whole bunch of people calling in, and so we're paying for a big package for certain people, but maybe only for one person in other ways.
It's a cost per employee, not the number of dependents on their plan.
Okay, because there could be six different people that called in from different places in the United States, theoretically.
Well, they would have to be included on their plan.
Yeah, but when you go, 24, 25 is how long it extends, or 26?
26.
So that span, you can have 6 kids throughout the country that are calling in.
But that's a convenient feature for them as well. I mean, when you're a college student, your in-network doctor probably isn't close by. I had that problem when I was in college. I had to drive 2.5 hours to go see someone who was in network. And so this would have been a great feature to have for the little things, like having a sinus infection or having questions, allergies, those types of things where you can just call and say, is this, is this that? But also, as Heather mentioned, it's a great piece for behavioral health and mental health. The stigma that's still on those pieces is still so high that any person might be afraid to walk into a psychologist or psychiatrist's office or even a counselor for someone to see them walk into that office. And so this gives them the privacy of doing those consultations from home.
Well, practically, I see this being a convenience because a lot of people feel sick enough not to go anywhere. That means the doctor too. And it's only after they get frustrated that they sometimes arrange to go see the doctor. So there could be a preemptive thing when you're first sick, you call and get some consultation and you get on the cure faster.
Right. Or if you have a family, if you have 3 kids that are home and one of them's sick, you don't really want to load all of them in the car and go to the doctor and wait in a waiting room where there's other sick kids that could get your 2 healthy kids that aren't sick, and then you have that problem as well. Or maybe they all have the same condition, and if you were to take them all to the doctor, you would be paying a copay for each child. This way, it is a cheaper option to get the
One
service
last
that you
question
need.
I have there been any studies about the effectiveness of the diagnosis by the phone versus then a complication that comes because it was diagnosed too mediocrely? In other words, I think you just got this, and it turns out to be appendicitis instead, or maybe a ruptured one because you understand what I'm saying, is it?
And I'm sure there have I researched those to present to council? No.
Well, does the industry have something like that?
Yeah, I'm sure there are studies on the effectiveness of teledoc, and the teledoc doctors will say this is not something we're able to treat over the phone. You need to go into a physician.
Especially if you're abdominal, but here's what I mean. The time saving is a big thing because, I think the average wait in a waiting room, hour and a half or 2 hours, depending on the time of day. And again, there's people that you got a sprained ankle. You don't want to go into the doctor's office when there's a whole bunch of sniffling, coughing people there, potentially. So there's motivation. Now, there's going to be some who resist that because of they like their own personal physician. But I think it's worth trying, because the benefits on the experience rating potentially, I think, outweigh some of the other issues we're dealing with. So,
Based on the cost and our experience with Mercer and all that, what are you recommending that we do?
So I have 3 more slides, and I'll go through them really
I'm just
quick.
trying
It helps because I give strengths and weaknesses for the other. I know you are trying to move along. So Mercer has a lot of strengths in terms of we have a long-term working relationship with them. They're familiar with us and our services and our needs. They're involved consulting services, and they're really responsive. So if I get a hold of them or I email them, they respond within less than 24 hours. Usually it's within the hour. They have national assistance. They have access to national surveys and national reports. They're actually some of the creators of a lot of those surveys and reports. They have a great working relationship with Aetna, which is really important since Aetna is still a newer carrier for us. There's still a couple hiccups that we work through, so they help mediate those. And their customer service is amazing. Some of their weaknesses were the teledoc. It was the most expensive option for employees, so $40 per consult. As I mentioned, that's more than what you would pay in a copay.
could that be negotiable, though?
I don't know if it is. It's just a package deal that they offer. I haven't reached out to them to see if that might be negotiable. Aetna also offers a teledoc feature. It's 20 cents per employee per month, which is a cheap cost, but the consult fee is still $40. So it's still more than what you would be paying if you went and saw the doctor.
And that's per consult.
And that's per consult.
Yeah, that's
exactly.
not per employee.
And the RFP didn't address our new needs. So they definitely are great at what they're doing for us now. I don't know if we asked them to do more and above and beyond. They didn't address that in their RFP, and it could potentially cost us a lot more than the $25,000.
And what do you think long-term? Have you looked at the idea of maybe that we pick up the cost of the consult fee? I mean, in order to encourage people to do that, that might be one way to do that. And every time we spend that $40, you would think that we're going to be saving money. Have you given that any thought?
I don't know if that would necessarily be the best route to go. And you have people that, like hypochondriacs, for example. So if you think you're sick every other day and you're using the teledoc every other day, that's something that the city would have to pick up. Additionally, all the dependents are on the plan. So if you have an employee that has a spouse plus 4 kids, for example, and they're all using that program, it could escalate quite fast. The Levitt Group, it was the strongest RFP that we saw. They're a local Southeast Idaho presence. Like I mentioned, they're out of Idaho Falls, so their ability to be on site is a lot higher. They can do it within a day's notice, or probably that day if we ask nicely. They have regulatory compliance built into their plan. They can help with COBRA administration, which is included. That's when an employee leaves employment, and they have the opportunity to continue medical, dental, or vision at 100% of the premium plus 2%. And so they would administer that. Currently, I do that, and it takes up a chunk of my time. They also help with things like FMLA and other ACA, that type of compliance and administration. The teledoc was included, no additional fee above the $780 per employee per month, and no additional fee to the employee. So they had the strongest teledoc program. They have an on-location enrollment team. So currently, during open enrollment, it's just me that works with every employee to make sure that they get enrolled. They have an actual enrollment team, so they could come out and assist me and work one-on-one with employees that need maybe a consultation, what program is best for them, and it could speed up the process and make sure that the people are getting the services that they need to enroll. They do annual seminars and webinars about compliance and healthcare, so that's in person and online, and they offer employee services, which is a piece Mercer doesn't currently offer. If an employee has a problem with a claim, or there's something that's a little off with their coverage with insurance, they currently ask me, and then I go to Aetna and I ask them. That's, I'm learning about employees' health problems and health complications, or their spouses, conditions and things like that, that I would prefer a third party handle. It just makes it a little bit better long-term. Then I don't have that information, and we are HIPAA compliant, but it is a big stressor for me to know those pieces of information. So they offer employee services, so they can help them with claims and benefit questions, and I would still be here to answer the basic level questions and coverage type options. But if they had a specific needed help with a claim, or it wasn't processed correctly, or they're experiencing a certain condition that they don't feel comfortable talking to me about, they have a third party option. Some weaknesses with the Levitt Group: they are a new vendor. There is the potential for rate fluctuation since they base it on a per employee per month, and the transition period. So we would have to transition from Mercer to a new group. And then the Murray Group, it's my last slide, I promise. Some strengths: it's a local Idaho group. So the Murray Group is actually out of Coeur d'Alene originally, and that's where they started, and they've worked their way down and around the state. So they are knowledgeable about Idaho law and employment law and all of that. They have a robust service team. They have attorneys on staff and specialists. My favorite piece is they have a Medicare specialist on staff. So for our employees that are reaching retirement age or reaching age 65, I'm not a Medicare specialist. And so I am not available as much to those employees that are trying to bridge that gap. They do annual employee benefits summit, so similar to the Levitt Group. They also have the ability to provide on-site employer workshops like harassment, HIPAA compliance, Department of Labor audits, and things like that. They also have the teledoc piece. It was kind of a hybrid, so you paid more for the teledoc per employee per month, but the consult fee to the employee was nothing. And then some weaknesses, they are the most expensive option, but they do include that robust service team with all the specialists on it, the attorneys and everything on staff. They're not in Southeast Idaho currently. They are in Boise, but so is Mercer. And the extra fee, they have an extra fee for COBRA administration where the Levitt Group included that. So
Another quick question about the teledoc fee,
Okay.
so just so I understand it. So if we do the teledoc thing and you get on the phone, you're on there with the doctor prescribes you a prescription, you pay the copay. Is that all that's getting paid, or is the insurance company paying something as well?
with the teledoc program, if there's no consult fee attached, so like Mercer has the consult fee of $40, but the Levitt Group and the Murray Group, there's no consult fee attached. So the employee pays $0 for the consult, no copay, nothing like that. Insurance is not attached to it. It's just the teledoc program. If there was a prescription, that would go through insurance and you would pay your copay for that prescription. But if it's just, for example, a mental health consultation and you're just talking to the physician, then you're not paying anything for that.
And the insurance is not.
Insurance is not paying
But it's
either.
built into that price, so it's not built into that price, plus every time they do it, Aetna's going to pay $100.
No.
Okay, so and I like that. So I think we need to go back to the idea of at least kicking it around. I think long-term there's savings there. I spent a lot of years in the EMS industry and was in the ER all the time, around ER docs, and we had that same kind of a system where if you had a child that was sick, had a sore throat, you could consult with a physician, they would write you a prescription, you could take care of your child and not have to take him into the doctor and pay $150 for an office visit, okay? That's not something the entire medical community's up for doing, but in this kind of a system, I think it is. I think there's potential that if we have employees that can do that, and we pay that cost, even if we had to limit the number a month or a year or whatever, you know, I think there's savings there to encourage people to do that. So if my wife's sick and I can get on the phone with the teledoc and it costs $40 and we have that conversation, they do the prescription, we have to go get the prescription like we would do anyway, there's a $40 cost there that's got to be cheaper than if we take her to the doctor's office and do the same thing for a couple of $100. And we're going to pay that as a city somewhere along the way anyway, is what I'm saying. So I'm not too sure it wouldn't be a good investment to at least think about paying that copay up front for the employee and saving that $150 office visit that we as a city are going to pay in our insurance exposure at some point anyway. At least that conversation.
For the three that we're recommending, only Mercer would have the employee portion.
Right.
The other two, there is no cost to the employee, so there is nothing for the city to pick up.
Okay.
The per employee per month cost with the Levitt Group, it includes teledoc.
Okay.
If we decide to go with the Murray Group, then that we will be paying an additional $425 per employee per month on top of their set fee. So there will be no additional cost outside of that.
It just looks like there's a big savings.
I agree. That's why we are pushing 3 programs that include it.
On Mercer, it says involved consulting services. What in the world is that? Because you don't have it on any of the other two.
Well, I work one-on-one with Mercer, so I am privy to their involved consulting services. I haven't worked with the Levitt Group or the Murray Group. They might also have involved consulting services, but what that means is my direct contact with Mercer is on every piece of correspondence that I have with every carrier, and they get involved and they make sure that things are followed up on. Sometimes, I don't have time to babysit one claim or one issue that we're having, and so she makes sure that it gets followed up on at a timely manner, and if it hasn't been answered, that it gets answered, and she follows up on that and helps me. So it's very involved. It's not hands-off is what I was trying to say. They're not just there.
Okay, I like the Levitt group, and here's why. A month ago, I was in doing an annual follow-up with my primary care, who also happens to be my nephew. Okay.
Family discount, we like that.
Yeah, I wish.
That's good.
Okay, I said, good grief, your waiting room is just packed. I said, either you have a good bedside manner or it's your personality. I don't know what it is, but he said the sad part of it is, he said 90% of these people don't need to be here seeing a doctor. They just need to be home, resting, drinking plenty of fluids, so on and so forth. That's where I think the savings come. You kind of alluded to it in a more exaggerated way with the hypochondriac, but we raised our emergency room fees to $100 out of pocket to try to direct people away from the ER if they didn't need it and into a physician's immediate care. I agree 100% with Councilman Moore that we've got to look at other avenues to try and control these health care costs, whether it be Health West, whether it be contracting with our own physician. Again, this begins to start, and I like the Levitt group. So.
How do you know that the 90% of the people that are in there would use the teledoc and not just go anywhere?
Well, then somehow that's going to be incumbent on us to figure out how to make that work with our employees. There's got to be a way to encourage our employees to use that system. I don't know what the answer to that is, but you're absolutely right. It doesn't do any good if we can't somehow convince our employees that this is good for everybody. It's good for them, it's good for their time, it's good for their family, it's going to be good for our costs long term, and somehow we've got to figure out how to do that. And that may take some cash or something.
Well, again, how many children? You have 2 or 3 children?
I have 2 children.
Okay.
And you said earlier, how often do you?
Well, but do you want to do?
Honestly,
always.
No.
Yeah, because
like once every 5 years. I'm serious. I guess I should knock on wood. I'm glad we have a healthy family, but I would not be calling it all the time.
Here's an example. I have a preschooler. Pink eye has hit my family before. I'm not going to lie. We have had pink eye, and 3 of us in the household had pink eye. I can take a picture of each eye and send that to the doctor over teledoc and get a prescription for all 3 of us without dragging our germy selves through a waiting room.
And waiting.
As my husband isolates himself in the other part of the house. So there are some very easy ones. That's low-hanging fruit. If your arm is bent in a weird angle, you're not going to call teledoc. Right. You're going to go into the ER. So this is educational pieces.
But if you have flu symptoms, if you have cold symptoms, there's a lot of things that will. And every time you do that, it's going to save our system money.
Those are educational pieces that the groups will help us with. Part of their, we'll come down, we'll do enrollment. They will help us educate employees. They will help us generate education materials, so they don't just have to listen to us talk, because everyone is sick of hearing me talk. We can provide them pamphlets, we can do emails, we can have other people come in and talk to them. But the other basis of the RFP is the underwriting services, is the COBRA administration, is the compliance. All 3 of these groups can do that. You had that specific question about our bullet point on Mercer. Quite honestly, their presentation was very lacking. They didn't address everything we needed. So we tried to make sure that their slide didn't look quite so pathetic, because they have done a very good job for us.
They have, but they've got complacent, I think. Just a little comfortable.
So we are aware of what they're bringing to the table because we've worked with them. Mm-hmm. So we're aware, Nicole is aware of how hard they work and the in-depth pieces they put in. To sit and define it, that's 13 years of history that they have with us. That's that's a big carrot. But I think they're lacking in some of the other pieces that the council has shown interest in. Yes, teledoc is going to be an educational thing for employees. Not everyone is going to use it. Is it generational? Is it type of job? I don't know. We have no data on it because we've never used anything like this at the city. Will it be used? Yes. Do I think it will be used widely? I do. Will it be used appropriately? That's where we need to get the education piece out to employees. Any of the three groups will meet the basis of what we need. It just depends on what kind of bells and whistles you want them delivering.
I'm leaning towards the Levitt group.
I'd agree.
I think you get more for your money there. And when we're trying something new, I want to get more for our money the first time out.
I agree.
Because we can tailor it after we learn a little bit more.
Okay.
Is there any way to get any kind of, like, I guess, references or something on the Levitt group so we can know
We
that?
have references for all of, we required 3 references minimum. They're in here.
And have you guys talked to those other
I have
people?
not yet. So the references for the Levitt group are the City of Idaho Falls, City of Rexburg, Teton County, and Jefferson School District. So I can definitely reach out to them. Levitt group actually came and talked to us before we put out the RFP, and we were quite impressed with what they had to say.
And they started at $10 per employee per month.
And when you talk to one of your counterparts at any of those places, you're going to know whether they're on track with what you're looking for or not.
So if you guys have like a top 1 or 2, we will call and we will check the references.
Okay.
Okay.
Another question on that. Where they've got the teledoc all rolled into their fee, if it became apparent to us down the road that it wasn't widely used and the employees didn't really care, I mean, I know we are hopeful that it would be a benefit to the employees, but if their fee goes up, we can't really sever that piece from them, right? Because they rolled it all in together.
I don't know. It's rolled in with the cost now. I don't know if they can sever the piece out.
Okay, because I guess the thing that I keep thinking about is essentially, you know, increasing it $20,000. I'm not disagreeing that it sounds like a great plan and it seems cool, and I know Councilmember Orr would use it frequently. And so if we just had like unlimited money, I would say do it in a heartbeat. But I know we've got a lot of other departments that have some needs, and so I'm sure they would all be saying, yeah, I'd love to have 20,000 more in my budget too. So I guess I'm just kind of looking at, you know, that's real dollars that are getting spent if we go with that, and so I would want to make sure that that was.
The other big piece that the Levitt Group, I believe, has over Mercer, if we're just talking about flat dollars to dollars, is they do have those advocates for employees to call so they don't have to come into Nicole to get help with claims. They have an independent third party that they don't see on a daily basis walking through the hall. They can help them with issues. It's hard for them to come in and talk to Nicole, but they know that's their only resource because they can call Aetna, but let's be honest, that's a major corporation they're getting the runaround from. Whereas they have dedicated people that will help that employee. So the cost isn't just the teledoc, it's the other features that they offer. I mean, it's easy for me to say because I don't have a serious health condition, but if I had something that, you know, was private or that was uncomfortable or like a long-term illness, I wouldn't want to have to go in and talk to my HR department about it.
Right.
I mean, it's kind of hard to put a dollar amount on that, and I know it sounds very lofty sitting here, but it is incredibly hard for employees to come in, and we have a lot of people that come in crying because, one, they don't want to talk to us. They have waited as long as they can, but when they have a $10,000 bill sitting in front of them, they need help.
So another thing I would be interested to know if you do call and get the references on the Levitt Group is how long people have been with them and if they've had a lot of increases over the years, because I guess another concern I have is, are we just getting a good quote right now and then it's going to go up a lot and then we're going to realize, oh, maybe we can't afford that anymore, but now everybody's used to teledoc, and so then employees are sad if it has to, you know, if the grass wasn't greener and we go back. I mean, these are just concerns I have, so
Well,
I would just be
teledoc
interested
is
to
Well,
know.
that's-
You're absolutely right.
Yeah, it is. So, there's anybody out there with kids in the audience? Do you go to the doctor? Do you take them to the doctor more than once a year?
Yes.
I mean,
it's maybe twice.
I mean, my wife worked in the school, the grade school particularly, and again, you know, maybe there's parents that don't take them for just a sniffle or something like that, but pink eye. I mean, believe it or not, when school gets back in, the cold weather comes around, head lice is not just a low-income person's problem. It hits everybody. I mean, it's like cockroaches in the South. I mean, everybody's got cockroaches, no matter how clean their home. And again, the issue is trying to get them to use it. But I can't believe there's a person out there that would not prefer calling on the phone for something like a sniffle or a sore throat or pink eye versus sitting in a waiting room for however long it takes.
I'm not disputing that at all. I'm just saying it costs money to.
Well, yeah, $17,000, but I think with all the other benefits, it can be paid.
We can call and check references and check length of service, and we can see if we can get a price history.
And then didn't you say the Levitt Group had been bought out or part of the AIS?
The
group?
American Insurance Service,
Right.
and they joined with the Levitt Group. They weren't bought out, so they just have more resources.
So it's kind of a collective bargaining group, for lack
And
of
if
a better
that's
term.
the group that you're interested in after we check references, we can see if they would come down and present to council, and then you could pepper them with these questions they would have immediate response to.
I do know that
Well, that'd
when
be
they
good.
presented to us, I think it was City of Rexburg, they talked about having a negative increase, so a decrease essentially in their insurance premiums last year after their in-house underwriter got a hold of the increase, and I think it started somewhere around 10 to 15%. So that was something enticing. It probably wouldn't happen every year, but to have the ability to have someone negotiating for us that could potentially bring us a decrease in premiums would be beneficial.
Did they have a consultant before, or were they didn't have somebody?
I don't
know. Okay.
I don't know that piece, but when I call, I can definitely ask.
So we're not just getting the teledoc, we're getting the negotiation and all that as part of this.
It's a lot bigger than the one feature.
Well, you know, the idea that this could dramatically go up, we kind of know where the top is with, if you take that 54,000 and take your 4.25, it's going to be 77,000 roughly is probably as high as we go.
Yes.
And so we're framing it somewhat. A couple questions. We already have some online consultation with Aetna, don't we? If you have something going on, you can get a hold of the insurance company and
Well, you
they'll
can
do a
call
little
about
bit
your
with you. I mean, it's not like a doctor, but you do have a little bit there, don't you?
You can use the Aetna website to access information. I don't think you get any interaction with it.
You can, there's a symptom lookup feature in the app, but I mean, you can look up symptoms online and diagnose yourself with some crazy condition.
Yeah. I mean, there is something, I haven't gone to it. But
And we could look at teledoc just because we've been talking about that feature a lot through Aetna, but then the cost of using that through Aetna is higher than the COVID.
Yeah, well, and I'm wondering if Aetna will take into consideration that we've expanded this service next time around too. You know, if you're looking at your experience ratios, if this really makes an impact, then Aetna has to consider it. I mean, that's bottom line.
Yes.
Right, and Aetna has already said that they're going to reevaluate our claims because, like I mentioned when I presented, they only have about 4 months of claims history that have been processed. And so if in the next year we don't hit the threshold that they thought we were going to hit, we're not going to see the increase that we're seeing this year. They're going to take that into account.
And so I'm real comfortable. I don't need to go a lot farther. If we're going to do this, and I want to make it clear, this is a part of the big puzzle in terms of healthcare management that we're doing. We're saving the employee, making healthcare more convenient, giving them a lower cost access point with this. That's really all we're doing, because we don't know what the performance feature will be in experience, but we are making an attempt to go in another direction and create a larger platform in healthcare.
Exactly.
So it sounds like the Levitt Group is what everybody's interested in. Is there another group that
And we
council would
probably
like
aren't going to
look at?
change our mind the next time we talk to you, probably.
Oh, I have no doubt. This is written in stone.
Are there any other questions
Status
that
quo, we already
We
know,
don't need to look
Mercer
at
and stuff.
that you would like me to either ask the Levitt group or ask the references?
I think if you get the references and you get the answers that you want, we've made that decision, that's what we ought to do, I think.
Do you want them to come do the dog and pony show for you?
No.
Okay.
I think we turn it over to Steve Brown. He's met with them once before with your group. If he's okay with the references, we're okay.
Okay.
I'm sorry, I didn't get what Councilmember Johnston preferred.
Well, I'm happy to go. My biggest concern is I would love to see this room filled with employees and have this presentation so that they felt good about it. We made decisions relative to Aetna. We have a number of employees that expressed dissatisfaction, but I would like to see a presentation before the final decision is made so that the employees buy in.
I would like to see it too.
Well, you get the references and stuff, and then we'll
Let's have a
schedule
public
a
hearing.
time for them to do that.
So if the
And
employees don't buy in,
do I
we're
need to
not
try to
gonna
wrangle
spend
that
this
during
money.
a study session?
Yes, we'll do it during a study
That's what
session.
you're saying.
I know, but I just want them to feel good about it so that it is explained before it happens what's going to happen.
I'll give you the date.
Logan, how do you feel about it?
I'm guessing we're going to aim for June.
I mean, I'm more than happy to let these people that are here weigh on it too. So, Logan McDougall, Public Information Officer.
Hi.
Hello. For me, it really doesn't matter all that much personally for insurance because I'm covered under my wife's insurance with Idaho State University. So.
There you go. Get out of the seat.
Thanks, Logan.
Anybody got different views?
Let's go ahead and schedule a time, then do the reference checks and make sure. I mean, the last thing we want is to find out that they're going to cost us $42,494 this year, and next year they're going to be $100,000. So we don't.
Next year we just bid it.
Well, we don't want to go through the bidding process every 15 days because we can. So let's find out what we've got and where they are, and then let's schedule a time for them to be back, and then we'll go from there.
Yeah.
Sounds good. Thank you.
Okay, thank you. We'll move on to agenda item number 6. The Zoo Idaho entrance building and projects update. Parks and Recreation Administration and Zoo Idaho staff will be present to update the council regarding various current and upcoming projects at the zoo. Staff is also seeking council's input and direction regarding the zoo entrance building, specifically the request that council consider supporting and granting permission for the following. A, support the preferred log cabin zoo entrance building and gift shop design as submitted by Lodge Log and Timber based in Boise, Idaho for a quote price of $90,535.50. B, grant permission to proceed with Zoological Society purchase of the structure and support the city and Zoo Idaho. C, grant staff permission to solicit a professional services contract for construction of the zoo entrance stairway and building concrete pad for council consideration at future meeting. And D, grant staff permission to bring the zoo entrance building architect engineer fee proposal of JHS Architects in the amount of $20,150 forward to council for further consideration and recommended approval at a future meeting. Good morning.
Good morning, Mayor and council members. John Banks, Parks and Recreation Director.
Peter Pruitt, Superintendent, Zoo Idaho.
And it's been a little while since we've presented to you on the zoo, and we're very excited to share with you some of the significant and also cost-conscious improvements that are going on up at the zoo and taking place. And Peter has put together a really great presentation, and here we go.
Before we start with the presentation, I just want to give everyone an update on our Zoological Society. They've changed their name from Pocatello Zoological Society to Zoo Idaho Zoological Society. They are working on events, fundraising events for May, June, July, August, September. Their first event will be May 20th. It's mornings with Marmy. It'll be a little breakfast event. And they've got a new webpage for their society, Facebook, and you can purchase tickets for that event through Eventbrite. They are also working on a joint membership with the Idaho Museum of Natural History, where you can buy a membership that will also get you into the zoo and the museum. So they're working with other organizations and developing some synergy within the community. And we just got 3 new members last Tuesday. So the society themselves are really starting to move forward and picking up momentum as the zoo is picking up momentum too. We have been for the last few months working on a master plan for the zoo. The nice part about this is our animals, what type of animals we'll bring in have really been decided by our mission statement. We are committed to preserving and conserving Intermountain West wildlife and habitat through conservation and education. All animals that are native to Idaho and the Intermountain region. What we've been focusing in on, however, with the master plan is our exhibits that are cost effective, that aren't going to break the bank of the city of Pocatello or the Zoological Society, and projects that the community can very much get involved with and participate in and get in place at a relatively quick pace. And so people do start seeing improvement. And of course, our big one, 2 big projects this summer will be the gift shop and our wetlands exhibit that you can see right up on top there. This is our goal for the 2017 season. Of course, the gift shop is our #1 priority. We want to finish that as soon as possible, and it looks like, since the zoo is already open 7 days a week, that the goal for finishing the actual building will be for the FY18 open season next year. Trying to put a building in right now will get in the way of our guests. It'll make it very inconvenient and hard for them to move through the zoo at the time. We are also working diligently on our new wetlands/trumpeter swan exhibit, which is replacing the 8-acre bison, pronghorn, elk exhibit up on top. Talking with U.S. Fish and Wildlife Services, we've actually slid that. We were going to break ground in the middle of June. We're going to move that to the middle of August. April kind of put a kibosh on a lot of projects, not just within the zoo, but within Fish and Wildlife Services. The rain, the wet, the snow really stopped a lot of projects. We need to get the elk, bison, and pronghorn out of that area first, and that gives us a little bit extra time to get those exhibits up and correct. And it also, U.S. Fish and Wildlife Services is getting behind the 8 ball on a lot of their projects too. So it lets us actually put the focus on the wetlands 100% when we start, versus we got to get this done because we've got to do other things. And in that process, we will be building a new bison and pronghorn exhibit, and then a new elk exhibit down below. We're actually starting on the elk exhibit right now. This is the schematics for our gift shop, and the Zoological Society has committed to purchase the building for us. And this is from Lodge Log and Timbers out of Boise. It is a 2-story gift shop, log cabin gift shop, with a deck, an upper deck that faces back into the zoo. So when you use that loft, you can step out and look over the zoo across the lower level, and you'll have a nice view of the zoo in general. We're also adding 2 unisex bathrooms in that, which will give us 4 flushing units on the bottom. And the goal or the thought is, as attendance increases and the need for more flushing bathrooms rise, then we'd come back to council and ask for additional help. And hopefully the society will be at a point in where they can actually help with the funding on additional bathrooms too. We will build when we need. This is the estimate for the log cabin structure. It comes in just right above $90,000. This is for the material. It isn't for the actual HVAC stuff, the bathrooms, etc. That'll be an additional cost. This is just for the logs that will go in. And the Zoological Society has committed to purchase the building for us. This is basic schematics for the wetland exhibit up in the Bison Elk Yard. You can see the education building is off in the upper right-hand corner, and we will have a pathway that loops all the way around the wetlands exhibit. We will include rest stops and shaded structures. The tough part about a wetlands, we don't want a lot of trees because they bring in raptors and other predators. So it's going to be open. There's not going to be a lot of natural shade, so we will supply the shade for them. Included in that wetlands exhibit is an additional education center, which we will work towards funding for that. And in that educational center will include an additional 2 unisex bathrooms. So we're working on ways to getting flushing units up on the upper level of the zoo too, incorporating bathrooms with our exhibits. We had to make, go ahead.
When you do the wetlands, where are you getting the water?
It's used that we've got a 6-inch city line right underneath the...
Okay, so it's city water.
Yep.
And will it stay there very well?
So we just finished actually a soil test. We're working with Intermountain Aquatics, and these guys actually, that's their job. They specialize in wetland restoration projects in Idaho, Wyoming, and Montana. What it looks like on the north end of that exhibit, it holds water fantastic. We've had a pond there since the beginning of April. We will have to do a little bit of work on the south end, and we're discussing whether we bring in a liner or clay. Bentonite, but chances are that we will be able to use clay. A wetlands is not a pond. I know Edson Fitcher, talking with Fish and Game, is having some difficulty in maintaining some of their water levels. The deepest part of this wetland will be 3 feet. And when you look at the pressure that the water puts on the soil, it will be minimized. And yes, there is going to be, we're going to manage the project like a traditional wetlands, where we will allow evaporation to occur as the summer moves along, because we want to attract some shorebirds. Shorebirds won't necessarily nest in the actual water. As the water evaporates off the side, then these shorebirds will come in and start nesting along the sides of the wetlands. So there will be some fluctuation. We don't plan, the plan right now is to, once the grading is done this fall, we will fill the wetlands up. We will monitor it, and we will get an idea of the actual water fluctuation, and then start our vegetation planting next year. So we're taking our time on all of this project. When we have a delay, it's not because, oh my gosh, something funny happened. We want to make sure that when we put this in, we put it in right the first time, so we don't have to come back and make adjustments. But there will be some natural water fluctuation.
Okay, and so I guess somebody should be able to engineer how much water it will use.
Oh yeah, that's what we were, with the soil testing that we did at the beginning of the month, that's going to give us an idea of how much seepage we already have in the soil right now. And then once we do the grading and we get the clay in there, we'll do another seepage test before we fill it completely up. So we will have not just an idea, we'll know how much water does seep through the soil.
Okay. So just to fill it, theoretically, it's going to take 5 or 6 acre feet of water, if it's 3.5 acre.
Yeah, I'm not sure on that one yet. My expertise is not wetlands.
Well, I know, but I'm just saying, you know, if you're going to fill 3.5 acres and you're going to be 12 inches deep or deeper. So.
Yep. So we've delayed construction with Komatsu until the second and third week of August. Komatsu actually sped the project up. The Komatsu of Utah is donating the use of their equipment for the entire project, and that's a $200,000 to $300,000 donation right there just off of the equipment. And this is the smart equipment. They will plug in the grading specs, and the equipment will actually do all the grading within 1 centimeter without bringing out a surveyor. It all comes in there. Right now we're working on a 3D model. They came out with a drone and flew over the exhibit, and they're putting together a 3D model for us to demonstrate on. The nice part about this too, Komatsu is also using it as a way to advertise their equipment. I've already been communicating with Tom from Streets, and if there's anyone within the city that wants to take a look at the equipment and actually operate, they will be welcome to come out and actually experience the use of their equipment on that.
So is it soon going to be driverless equipment?
Yeah, basically you're gonna, the only thing that you'll do, and they're gonna actually let me run one of the dozers. You just have to turn the dozer at the end and then turn it around, and then it does its own stuff for you. So
Careful.
I know. There goes the replica. I don't know what Peter was doing. We're also looking at, the equipment will be here for 2 weeks. The project should, if everything goes correctly, the project should only take 1 week's worth of equipment use. We are working with Komatsu, and we're going to hope that we can get some of the dozers down to the lower level and at least start some rough grading on an ADA pathway on that south side up to the upper level. That's another one of those things that, holy cow, if that comes about, that's going to save the zoo and the city a tremendous amount of money and time if we can get some of the initial grading on that ADA path with the Komatsu equipment. Again, I'm also working with Tom and Streets on possible partnership with asphalting through the streets departments, where the zoo would pay for the asphalt and the streets might come out and help us finish the asphalt pavement. So again, trying to reduce the costs at every opportunity via partnerships. We have $50,000 worth of funding through U.S. Fish and Wildlife Services grants. There is an opportunity that if we need to next year, that we would apply for another $25,000 grant. So there's funding still available for all of us. This is an example of what we hope in the end when we have a wetlands education center with this project. We will work with U.S. Fish and Wildlife Services and our multiple partners on additional funding. There are a lot of NGOs and other entities that are very interested not only in trumpeter swans, but wetlands restoration. Wetlands are a very important component to our environment and habitat. So including an education center with easy access to a wetland is really truly an amazing opportunity within Zoo Idaho, Pocatello, and eastern Idaho. It's not easy to get to a wetland, but we've got a pathway that will be right there for them. In the process of getting ready for the wetlands, we will be working on new bison pronghorn exhibit and an elk exhibit. This is another schematic within the master plan. One of the concepts that I'm really excited to work with through our master plan is educating the community on human and wildlife mitigation ideas. Last night we sat at Fish and Game and talked about the deer problem within city limits. The zoo cannot take any of the deer, but what the zoo can do is to help educate people on how to live within areas that wildlife are moving into, or as we encroach into wildlife habitat. We have the opportunity to educate people on how to mitigate a lot of these conflicts. And education really is the beginning of solving a lot of these problems. And so that's an opportunity that the zoo has. And one that I've always been fascinated with is these over and underpasses along interstates. wildlife is being fragmented, and we have to develop corridors to move wildlife back and forth. And this is an example of a wildlife overpass. The zoo will always have wildlife overpasses because we don't want to have to walk in and pick up the trash that people drop down into an exhibit. So we will have these opportunities throughout the zoo. The bison pronghorn exhibit, the elk exhibit will have one of these, and a bridge right there is $50,000. And I've already contacted contact out of Salt Lake City. The great part about them is they do work in southeast Idaho. They work with a concrete company out of Idaho Falls to fabricate the bridges. So if we get to the point where we are able to purchase a bridge, it still stays within Idaho. And moving a bridge, a prefabricated bridge from IF is a lot cheaper than from Salt Lake City. So we're starting to build all these different types of connections. You can't really see it very well, but that yellow line really is, in the end, is the complete bison and pronghorn exhibit with one of those overpass bridges. It is a smaller area than their present exhibit. They don't need 8 acres. We would fill that exhibit to capacity with the bison and the pronghorn, but people have a greater access to them. They will be able to basically see the bison pronghorn on 75% of the pathway, whereas opposed to now, Murphy's Law says bison, pronghorn, elk will be kitty corner from where you are on that 8-acre exhibit, and you won't be able to see them. This is then an example of where the elk, mule deer exhibit and the ADA pathway would be put in. We're connecting the present mule deer exhibit to the old bighorn sheep exhibit. Another one of those overpasses. We're going to use the natural grading to add those bridges and then slide the path up against our lava bench. It's a great feature. Nobody can get to the lava bench. If we're going to be an Idaho zoo, then we need to also exhibit our geology and native landscape. So this is a great way of getting people up along that lava bench. And that, in the master plan, that gap in between the lower exhibit, we'll end up putting a wolf exhibit in there too. So, and all of these, the initial half of these 2 exhibits we built in-house relatively cheaply. Instead of chain link, we'll use the high tensile game fence. It's just as strong as chain link and a heck of a lot cheaper, and we can put that in-house. Any questions on what we're going to try to do this summer?
Seems awesome.
Peter, the log construction, I know we've witnessed this and it's been in the planning stages for a long time, but it seems to me that if we get all that area out there being consistent, is this structure consistent with, say, the swimming pool and other things that are a part of our entire campus of city-owned property?
The log cabin will be consistent with the Zoo Idaho. And, the nice part about Zoo Idaho is that it is definitely part of Park and Recs, but we do have the opportunity to kind of make it its own special entity within the city. And when we look at, my goal is we are an indigenous zoo, and we really want to capture the heart of Idaho. And a lot of people look at Idaho with outdoor activities and wildlife and the log cabin feel. We'll have split rail fences on the bottom. We'll have the buck fences on top. So as you move through Idaho, we really want people to say Zoo Idaho is Zoo Idaho. It is Idaho. When you go to Idaho Falls or Zoo Boise, it says that's a zoo. But it really doesn't say, it doesn't really describe itself. There's lots of concrete in zoos. They even make concrete trees and concrete rock walls. We don't have to be a concrete zoo. We can be that, we can be the zoo that says we're Idaho.
Yeah. Okay.
Are we okay with the design of the log cabin?
Yeah, I think it's awesome.
Are we okay with the Zoological Society purchasing that? And we'll have to work out the donation piece of it in a future meeting, I'm sure, but we can do that. Do we have any concerns with them soliciting professional services for the construction of the stairway and stuff? Bringing that to a future meeting.
Oh, I'm excited.
We can't do it in-house.
It's being done.
It's going to be awesome. I hope when you got that equipment there, you can get that other part done. That'd be nice if you could make
Yeah.
that.
That'd be really cool.
So they send operators with this stuff?
They will send some operators, and then Fish and Wildlife Service is donating some of their time to do this. And anyone within Park and Rec City that wants to kind of see the equipment in use, they can train them and show them how, and they can actually get behind the equipment and run it too.
It just seems like if there's any opportunity for us as a city to do something well, we've got that piece of equipment there, to do that other trail
Yeah.
you're talking about that week, we ought to.
Oh, absolutely.
look at that. Whether that's buy the operator dinner or whatever.
Yeah.
That might be.
That's perfect. Kerry Meyer, who is with U.S. Fish and Wildlife Service, the gentleman that's working directly with this project, he's already said he's donating his weekend time to get into the dozers and get it down to the lower level and start moving dirt down there. So,
Awesome.
yep.
That'd be great. And then yes, you'll have to bring that the architecture's amount to us in front of her.
Okay.
Are we okay with proceeding with that?
I think so, yeah.
Mayor and Council, I just want to make a couple points of emphasis and acknowledge Peter for his really diligent work in kind of bringing a lot of these improvements to fruition, establishing a great relationship with U.S. Fish and Wildlife to the tune of $50,000 in grant funding the last couple of years, an opportunity for possibly another 25 for wetlands vegetation and other things. Also working with Komatsu for a couple, what amounts to a couple $100,000 in equipment donation. The possibility to get some good headway made on some potential ADA paths with just a need for fine tuning and asphalt at that point is going to be a huge cost savings to us. Working with the society on the desired and kind of recommended zoo building to be able to get an amenity like that blends into kind of the natural topography out there is going to be fantastic. And then also, lastly, just a thanks to council for, I know it was it wasn't, it was a little bit of a painful choice to move away from the initial design of the initial building and the design fees, but I really would like to point out that kind of the preferred design that we're currently advocating for is a complete cost of $280,000 to $320,000 with the design fees, as opposed to $763,000. So it's thank you for letting us do that. I know it was a big step on the council's part to move away from that initial design, but we think that this is just going to meet our needs great, and it's just more feasible. We're going to be able to get it done.
Yeah.
So.
And thank you for being patient with
Mr. Mayor,
this.
you got a great vision at the zoo.
We have a question.
Yes.
One other thing. This is such an incredible thing, the wetlands project. Is there any interest on the part of various departments at Idaho State University to participate with us on this?
We're already working with the biology department.
Good.
Yes, so with this project, one of the things that we're also doing is we want to get hopefully at least a thesis student, which may lead into a dissertation PhD. There's not a whole lot of information out there on once you start a restoration project or once you create a wetlands out of nothing, how long it takes for it to be established in a fully functioning wetlands, whether it's vegetation or wildlife naturally moving in. Again, with easy access to a wetlands like this, it opens up a whole world of data collection, not just within ISU, but within the community, the public school systems, our ed classes. With our new education curator, I lucked out. her expertise is wetlands. And I didn't hire her because her expertise was wetlands. There's many other factors. That was just a bonus. And so the avenues of this project go well beyond just an exhibit. We're already working with Fish and Game on other potential long-term partnerships that have come off of this wetlands project. So, yeah, this is not one of those build it and we're done for 20 years project. It's build it and every year it grows.
I can see some really neat things with some of our native geese probably coming in there. I know last night I was walking along the Portneuf River and saw a pair of geese with 9 little ones, and I just was fascinated to see how they took care of their own. And, if that was in the zoo, I'd pay to come see it.
Yeah, I know eventually we will definitely have wild sandhill cranes using the wetlands as a layover. We really do, if we get a great blue heron using the wetlands, then we've done our job.
Yeah.
Super. Okay, thank you very much.
Thank you.
Then we'll move on to agenda item number 7, Zoo Idaho Free Day sponsorship. Parks and Recreation Administration and Zoo Idaho staff will be present to review a request received from Connections Credit Union to provide a Zoo Free Day at the community or to the community on July 8, 2017 as part of their 80th anniversary celebrations.
Yes. Thank you, Mayor and council members. As you might recall, during summer of last year, council gave us permission to offer a community free day at the zoo. And the purpose of that was twofold. First, to kind of show appreciation for the community and their long-term support of the zoo. But then secondly, to gauge and measure about how many folks would come on a community free day, and could we possibly offer this to some of the business entities in town that might want to also provide a free day and generate a new revenue source. So we were very successful in 2016 with over 2,300 guests that attended. As a result, Peter and I have recommended a $5,000 community free day sponsorship in the fiscal 18 fee resolution. It was felt that the $5,000 fee accomplished a good balance of being reasonable and realistic for the sponsor, and also gave them good exposure, as well as a solid revenue source for the city. We have received, actually a little bit out of the gate, a Connections Credit Union request for a Zoo Free Day as part of their 80th anniversary celebrations planned for July 8th in Pocatello. The current fee resolution language provides staff a bit of discretion to accommodate special events and programs not specifically listed in the resolution as the fee arises, and accordingly we've kind of begun working with Connections Credit Union to try and accommodate their request. Of course, they'd be responsible for acquiring all the various permits and providing insurance also. They have a little over $8,000 budget, and they are we're planning on making a $5,000 donation to the city to provide a Zoo Free Day for the community. This would obviously be the first organization to participate in this program, and we're pretty excited about the precedent. We think it'll be a great benefit for the community to come down, enjoy Lower Ross Park as a whole, and also get a free zoo entrance. And also, we're ambitiously thinking we might be able to get 1 to 2 of these a year, which is a pretty good revenue source on top of other things we have going on. So we're obviously supportive of this request, and wanted to bring it to council to make you guys aware and just hear any input that you might have.
I think it's great that Connections is doing that, because they have a long history with the city of Pocatello. They go back 40 years. They were the employees credit union back in the olden days when it was Pocatello. So we've had a long history with Connections Credit Union. Yeah.
Yeah, they're nice people. They've been great to deal with so far. We haven't gone too far into it with them. We wanted to bring this to you guys first and see if you had any heartburn. We didn't anticipate you would, but at least.
But you never know.
But you never know. So, yeah.
You know us.
Good. I think it's great.
Okay. Yeah, like I say, since we do not have this as part of our current fee resolution, although we're recommending it for next year, we'll be treating this as a donation from Connections, and we'll work with legal just to make sure everything is okay. If we have to get a very specific 2-paragraph agreement, quick and easy, we can do something like that. But legal indicates that they're okay with that.
Perfect.
Great. Sounds awesome.
Sounds good.
Thank you.
Very much. Council, should we have a break before we jump into agenda item 8, or do you want to move right in? Okay, we're going to take a quick break, which for the council, we're not guaranteeing anything right now.
It takes longer to straighten out than old.
Thank you for joining us after our short break. I think it only took 20 minutes, which isn't a bad break for us. We'll move on to agenda item number 8, electronic billboards update and guidance. Staff will be present to discuss the council's safety concerns regarding electronic billboards in the city of Pocatello. Under the current Pocatello Municipal Code, there are no standards regarding the placement of these signs. Council may wish to implement a moratorium on electric billboards pursuant to Idaho Code 67-6523 while staff develops the appropriate safety standards for this type of sign. Once developed, these standards would be incorporated into the Pocatello Municipal Sign Code. Staff will be seeking council's guidance on this matter.
Good morning. I'm Terry New. I'm Assistant Planner.
Good morning. Rich Deal, Deputy City Attorney. Thank you, Mayor and Council, for letting us be here today. The basic question is, does the council wish to look or maybe establish a moratorium on electronic billboards within the city limits of Pocatello? There is provided under Idaho Code 6523 does provide for that cities or boards can establish moratoriums. And the basis for that has to be for there's an immediate peril to public health, safety, or welfare, and that the council, in this instance, the board, would need to make findings and establish them in writing. The effectiveness of that particular moratorium is 182 days, during which time staff, if the council was so inclined, would try to develop standards regarding electronic billboards. We are not, at this point, talking about standard static billboards, just electronic. The genesis of this, of myself meeting with Terry, is that over the last couple of months there have been some requests or inquiries regarding turning static billboards into electronic. And looking at it, we don't have any, other than complying with the ordinance, the sign can go up. And we have some concerns. In preparing for today, I've done some research. Terry and I worked together on this. There's some potential bases for the council court to establish. Generally speaking, there'd be aesthetics, traffic safety, and welfare property values. Without getting into details, there is some research out there that there's an increase of accidents at intersections or on roads that have electronic billboards. There is some research that supports the contention that property values of adjacent property or property within the area, the values do go down. And also the question, the aesthetics. I don't think we're talking a black sky or dark sky ordinance, but we're talking about something to deal with lights. One of the things that was pointed out to me is that our zoning ordinance restricts that, like, parking lights have to be shielded and pointed down, parking lot lights. Right. And we're promoting that through our businesses, when they put up signage and whatnot. Well, at this point, our billboards aren't required to do that. And I would point out to the council that there are other cities that in Idaho that have moratoriums. There are actually whole states, I believe Vermont, Hawaii, Alaska, and Maine prohibit billboards. So with that brief presentation, we're asking you if the council is so inclined to proceed with this, we will. I just want to get your input because this has been an issue that, as the council is well aware, this past Thursday, the topic of moratoriums was briefly discussed. I would say, for the point of clarity, it's my legal advice that the moratorium that was declared on Thursday, we can't defend it. It's not. It was carried, but it does not have the force of law. I would not be comfortable trying to defend that in a court of law because we would lose because there was a notice issue. So with that, I don't know if Terry.
When do we get to legislate based on the information in front of us? We do that when we're doing a public hearing and we have certain recommendations and we add recommendations. They're not noticed if we add something. They're not noticed as part of that public hearing, but we're able to add recommendations then.
Understood. And what I would point you, Councilman, to the statute does have the governing body may proceed without recommendation of a commission upon abbreviated notice. But nowhere in council's agenda for the last Thursday was there any mention of the moratorium. Correct. That's the issue I have. Just from a legal standpoint of trying to support and trying to protect the city's interests, because if at that point we would lose a fight in court, in my opinion.
So we may be okay to not permit a particular sign, but to declare a moratorium was where we kind of.
Yes, sir. Yes, sir. And since we're down this road, I'm crafting the council decision out of Thursday's night's meeting to be adopted in a future meeting so that the moratorium is not part of it because there was no notice given, in my opinion, but sever that from the decision that the council was handed down on that particular specific agenda item.
Mayor, can I make a couple comments?
Absolutely.
Okay. So, Terry, my concerns are going down the road that once we start down that road, how far we get down the road, there's no turning back. And with these particular signs, I can see that being a big problem. I'm not a big fan of electronic signs. That's my personal opinion. And I notice those kind of things when I go to other towns, when I'm on vacation visiting. I pay attention to those kind of things of what makes communities look good and what makes them look something like I don't particularly like. And signs, I think, is a big part of that. So I don't feel like, and I know we've talked about signs all the years that I've been on the city council. I get that. I know it's hard. I mean, I get that. But it's important for me to understand these new electronic signs. You know, what are other places doing with electronic signs? Because I think to a certain extent that's relevant. You know, what's acceptable in Boise? What's acceptable in Idaho Falls? I can tell you the example. We travel down to Las Vegas regularly and go out to an area called Summerlin, which is a huge subdivision of Las Vegas. I don't think they allow electronic billboards in Summerlin, and yet it's a beautiful place. It's thriving commercial business, but yet they're able to maintain a look that's different than the Strip in Las Vegas, even though they're attached to it. So those kind of things are important to me.
I actually just did kind of a brief survey of about 8 cities across Idaho to see what they did. And we have 2, Nampa and Boise, that do a cap and trade on all billboards, not just the electronic, all billboards.
And explain that to me.
Cap and trade is they have X number of billboards already in their city, and when somebody applies for a permit to install a new one, they have to take down an existing one. And so they cannot exceed that number. Okay. And Nampa and Boise have that. So that is an option. And let's see, Coeur d'Alene.
Well, Nampa and Boise aren't growing. Boise is basically pretty well bound. I mean, Boise City.
Right. Okay. Coeur d'Alene, Post Falls, Chubbuck, and Twin Falls ban them completely. And when the sign gets into disrepair and is needing maintenance, it comes down.
Okay, go over that again. Cover that for us one more time.
Post Falls, Coeur d'Alene, Chubbuck, and Twin Falls don't allow them. And an existing one, they aren't making them take them down as as soon as that ordinance was in place. But as soon as one goes into disrepair or is needing maintenance, it has to come down. That's
Is this
it.
any sign or?
Billboards,
Billboards.
Well, okay,
Billboards.
billboards.
just billboards.
What about electronic signs?
I didn't look into that. I just looked into billboards because that was the
yeah,
issue that
billboards.
we're
Okay.
dealing with. And then Idaho Falls does allow billboards, electronic and traditional, but they only have 3 zoning districts that they allow them in. And they're like the highway corridors. They don't allow them on 17th. They don't allow them down by the river at all. So that is an option, just to really completely limit the area where you can have them. Lewiston allows them, but they have a special billboard overlay zone. And so if you're in that zone, you can have billboards, but no place else in town. So just even in Idaho, they are actually becoming more and more restricted.
So it really isn't so goofy for us as a city to be concerned about billboards. And to give you another example, I noticed our new connector that we're so proud of. There's a billboard going up there right now. And if we don't pay attention, I'm guessing, I'm not real well versed on this, but if we don't really pay attention to this, in a couple of years, it'll be billboard city all the way through the connector. And maybe that's okay with some people. It's not particularly attractive to me. And so I don't think it is goofy for us as a city and as a city council to be concerned about where we're going with electronic and even regular billboards. And I guess my recommendation to the council will be based on what other people are doing and my particular concerns. We should pass a moratorium, and maybe it should be on all billboards, not just electronic billboards. That would be my recommendation. And I think as a community, we're really missing the mark not to do that. And I pay really close attention to this in other communities. And billboards certainly are a form of business. I get that. They may have some advantage to businesses for advertising. But as far as a look in a community, they're poor. They're really, really poor. And I think we're going down. We talk a lot about where we want our town to go, what we want to look like, what we want to be like. I can't imagine that when we bring in CEOs from businesses from other places and they come to town, that having lots of billboards would impress them. I just don't think that that's something that would look good to people who are planning on bringing their business here, bringing families here. I just don't think it's a good fit. So that's where I'm at with it.
Okay, Mike, you had a...
Well, so how come the billboard out on the connector didn't come before us?
Because it met all of our standards. We sent out, part of our process is we send out notices, and neighboring property owners have 21 days to request a hearing. Nobody requested a hearing, and so the permit was issued.
It's in the middle of nowhere.
But again, you got 200 feet, right?
Pardon?
You got 200 feet.
Yes. It helps that the property owner owns
all that property. So basically, how many more? Just off the cuff, how many billboards do you think could be built just right now on our connector under our current
code? Only one more, and that actually has to be on 5th and South Valley Road.
There's that far of a separation?
Yes.
Okay,
they can't go on the other side of the interstate because then you run into a residential zoning district.
Okay. But again, it's going to be there, so it's going up, it's going to be there forever. I'm going to get to see that, whatever's advertised on there, forever. And I think, I agree, it's under the code now, but I think it's something that we need to be really careful about, and that's where I'm at with it, Mayor. I think our moratorium ought to include all billboards.
Well, Mayor, can I have the floor again? I don't disagree about a moratorium if we want to address that, but we've done it wrong, okay? We need to notice it and then move forward, okay? But again, if I'm not correct, no one that was the meeting the other night lived within 250 feet of the billboard.
And that was, if I can interject, that was part of the problem that we noticed is our code basically is is geared toward the traditional billboard. And so that we notice people only within 250 feet of the property line of where that billboard's going to go. Well, those people were about 350 feet out at the closest. And so we're recognizing that these billboards, because of they put out so much light, that we do need to notice farther out to let people know
Okay,
what's going
that's
on.
understood. But again, if Councilman Moore would have been noticed or he hadn't known what was going on, he may have been concerned about that billboard going out on the connector.
Right.
Okay. My second concern is that we have an ordinance, was technically the law. Is that correct?
Yes.
I mean, legal counsel, that's technically the law.
Yes.
So we sit up here and people meet all the criteria of the law, and then we pick and choose who. So we follow the law when it hits our fancy, or we follow the law or we decide not to follow the law if enough people show up. What are you shaking your head for? Okay.
Okay, but look, so.
I mean, I'm just trying to say.
I agree. I agree.
Well, I'd ask this question.
Well, I'm not done. I mean, I'm trying to get, because again, there's 2 points of law here, okay? One, under the law of the city of Pocatello, or whatever it is, state statute, we have to follow a certain criteria to notice for a moratorium, right?
Yes.
Okay. Number two, because this billboard sign fit all the criteria out on the connector, and no one within 250 or 300 feet came and opposed it, Mr. Moore said right here that he would not like it. Okay? The same thing essentially happened Thursday night. Okay? No one within the notification zone was present. Okay? Here's what I really think we should have done. We should have approved that billboard and then started that sign and then moved with the process of the moratorium. That's what I think would have been right, justified, and fair. But that's just my opinion. So,
But can I ask a couple questions now?
Yes.
Do you have to be within 250 feet to appeal?
No.
Okay.
No.
So did we follow, was the law followed by the appeal?
Yes, it was.
Okay. Is not the hearing process of the appeal that we can make a decision then?
Yeah, ultimately the council has a final decision on any appeal.
It was appealed, and the law...
They wouldn't be allowed to appeal. There would be no, if there wasn't the ability for us to hear the testimony and make a decision on that sign based on what we were hearing that night, there would be nothing in the law for an appeal to come before us. It would have been a done deal. We should have never heard it. I mean, I understand what Councilman was saying. I get that.
But the law allowed that process to occur, to deny
Yes.
the placement of that sign. So the law was followed.
Yes, sir.
Okay.
well, but the board was approved. Okay. The appeal was to not allow the board.
Yeah, but the law was followed in upholding the appeal.
So I would really like to pull this discussion right back to this here and the guidance that we're looking at. It's not really the time to debate whether or not we follow the law or not.
We're in a debating mood.
We are, apparently we are. So,
when you got no leadership, I mean,
we understand that the law was followed the way it was supposed to. It worked the way that it's laid out to work. Right now, the question is guidance on a moratorium on the billboards now, and I've had one council member say, look, if we're going to put a moratorium, he would recommend a moratorium on all billboards, not just electronic, but all. And we have 180 days to write a zone and have the public hearings and all of that stuff. All of that will happen before it goes into an ordinance, is that right?
Well, what would happen procedurally is the council with written findings of facts would declare a moratorium. That would stand for 182 days. If the council wanted to extend it past 182 days, you'd have to pass a regular ordinance, or as the language of the statute is, adopt a interim or regular ordinance. So in essence, you would have the opportunity, the moratorium would prohibit the erection of more billboards during a 182-day period, during which time staff, at council's direction, would be preparing an ordinance, which in essence would be prohibiting or following whatever you wanted to do, whether it was the cap and trade, as is in Boise, or prohibition completely, like there is in Chubbuck, however you wanted to proceed.
Okay, so those are the questions that we're looking for the answers to, is what exactly is the council interested in? It sounds like we're interested in a moratorium that, well, I've got one, for all billboards. I've got two for all
we need
billboards.
to notice, I'm not opposed to a moratorium going forward, okay?
He'll handle that part of it.
Right.
We decide that's what
And we do it correctly.
Yes.
Okay. But I still think we ought to approve this one as we go into as we go into moratorium. And again, you're right, but again, Councilman Moore wasn't aware that a billboard was going out there on the connector, and he may well have been there to oppose it.
But a hearing was never held because nobody opposed it.
So what you're pointing out is that what we were hearing the other night, that there are problems with the distance and making people aware. I think when you compare us to some other cities, there's not too many people that live on a hill right above one of these in some of these other cities. So we've got some topography issues here as well that we have to consider.
St. George hasn't.
And I just think we need to take a look at all of those factors.
Yeah, they go over town when you go down through town.
Well, I don't have a problem.
So I've got two council members that have said, look, let's do a moratorium right now for 100 on all billboards, and then we'll figure out what we want to do. I mean, is that the pleasure of the council at this point, or I mean, the other option is not to do a moratorium and let the system work the way it's been working forever.
I'm not in favor of a moratorium. I'm in favor of commerce going forward, and if that's what the city wants, great. I am in favor of clarification on the ordinance. I thought we did a lousy job for Sanju the other
Yes.
night. I just,
because
if you followed the law.
If you look, yes.
So let's clarify the law.
Absolutely. And if you look at these numbers, I mean, you look at the nits, okay, he was willing to go down to 100, and the lowest I see on the, I pulled it up, is 450 nits for red only, okay? He was willing to have static on one side. Here's my concern, okay, is we are in the computer age, okay? The benefit of a electronic sign is that you can get multiple ads onto one sign versus a billboard. Once you put the wallpaper up there, it's stuck until you move it. I'm not saying it's a perfect, you know. Again, I've been talking about we need to possibly change this Pocatello Creek to exit 71 for potential growth. Okay. Yellowstone Avenue is a corridor, and that's what I was trying to say the other night about the one out there. Is there are neighborhoods around it. Okay, if you look at the angle of the one there as you make the bend on Yellowstone, it points back towards the trailer courts. It points back to the north edge of the El Rancho subdivision. For subdivisions, I would never let a sign like that go in. Again, I'm willing to look at a moratorium or something, or clarification. But again, what I feel like is that I come in, I fill out the application, I pay my fee, I'm told by staff, yes, I'm told by this group, yes, you meet all the requirements, and then you get shut down. I mean, how much was the fee for all this for Sanju?
$75, I think. 75?
That's all it is for a sign application and for review and all that?
Well, and then you have mailing labels.
Well,
So
okay.
that's a variable.
Because see, I mean, based on what it is, I mean, I've seen, and again, that's what I'm saying is the paperwork that we see is for an application varies by the process. But again, Councilman Johnson has said it quite well also. There's no doubt we need clarification. Terry, you've seen me sit in Historic Preservation Committee, and these graphics people come with their sign design, and ultimately the committee designs the sign for the graphics designer. So what I proposed then was that, well, let the group, the board, design the sign, tell the graphic designer what they want, and then he goes back to the customer, tell them what it's going to cost, because we're costing that businessman time and money to get that point.
And this is issue because this is different because the HPC has what is called design review, and there are design guidelines for the downtown.
I've read those design guidelines, and they're about as clear as this ordinance.
Okay.
I've read that little trifle. I've read, and
we actually have a little book.
And the HPC is in this same ordinance also. Okay.
Gary.
I'd like to discuss a little bit about Jim's comments about commerce. Jim, I don't disagree with you one bit, but again, I look at how things are doing in other places that are really doing well with commerce. I was just down at my son's new place in Arizona, Litchfield Park, Arizona. It's a suburb, I call it, of Phoenix. The place has grown like crazy. There's commerce there like we could only dream of. The new grocery stores, new retail, and those are supported by business, commercial businesses, manufacturing in this area in Litchfield Park where he lives out there. It's grown like crazy. All of those things are going on. There's new jobs coming in there. But when you drive down the street and you see the big new grocery store and you see this, you don't see a billboard anywhere. There's no billboards. As far as the eye can see, and it's flat there. And it has a different look. It has that new, crisp, growing, prosperous look. And I really believe, we talk about we're in the computer age. I think if you were able to poll younger people in the computer age and you ask them how they felt about billboards, even people that are packing these around with them and they live by these, I think billboards are a thing of the past in growing, prosperous communities, from what I'm seeing around.
And that may be the case, but the things that were said the other night in terms of property values going down, did any of you go up on that hill and look down? All you see is the roof of some big businesses, and I just feel bad for what we listened to and what was accepted.
Well, and maybe I wouldn't disagree with that, but let me tell you another observation, and it's not so relevant to this. My dad owns a property up on Charles Place. It's right on the edge of the hill. You can see the entire city from up there, right. And it's sweet. It's an old house in an old neighborhood. You can see the entire city of Pocatello from up there. It's about the same level as the water tank on the freeway right there. You know what you see from my dad's backyard now when you're sitting in the backyard out there drinking iced tea? You see the big sign at Hold Arena. Really? That big orange sign that's an electronic sign at Hold Arena, and is when you're sitting up there on the bench looking over the whole, and I think it's great, but when you're up there taking in the view of the city, you're seeing that sign flashing at Hold Arena, and you're looking at the sign, and you're looking at the sign. That captures, and that's a long ways away, but it's a pretty big sign, and it's a flashing, lighted sign. And while maybe it isn't that important, it does detract from that whole situation up there. And I'm not opposed to that necessarily, that sign, but I'm saying, as we move forward as a community and the more of that stuff happens.
Is that a nighttime situation or a daytime?
No, that's during the daytime. I think he said they actually shut that off at nighttime. Yeah. But during the daytime, that's what you see. It's that visible from that far away, and that's quite a distance, So that's just an observation, and maybe it's not that big of a deal. But when you're sitting out in the backyard looking around, that's what you see. That's what concerns me about putting another one, a gigantic billboard that's really only 300 or 400 feet from all those people that live over there on Patsy and that area and the area up above. So I can see their concerns. I too was a little concerned with the process. I don't disagree with that.
Yeah, that's my own concern.
But I still think moving forward for our community, this is a pretty big, important issue, I think.
I was the only one from the council that was attacked on TV for the position I took.
Oh, no, you weren't.
Your name was not mentioned.
It was too.
I only heard my own.
Yeah.
Some of us didn't even watch TV.
I just couldn't believe that people were unconcerned about the process. Because to me, the process, so it's got to be clarified. I want to see it clarified, but I don't want to do anything that's going to curtail commerce.
I agree.
Because we've got a lot of good things coming.
I agree.
And maybe we can have a street without the signs, but right now, the law says we can.
Roger. Well, first of all, we affirmed that the process was held all the way through.
But flawed.
But we had some problems, and we said we can't go forward in the process that we voted 4-2.
I understand.
Was upheld.
That's the main point.
We were the court on that. First of all, when you look at commerce, I agree with Gary. I've got some friends that do business developments and stuff in Alaska, Texas, and places. They don't even want power lines, let alone billboards. They don't want anything that obstructs their frontage views. And when I look at what commerce is doing, I look at how we're on our south entry, the gateway, it's all billboards coming in. And I look, it reminds me of when you used to go into Boise at Micron, it was all billboards going in. Now then there aren't near as many of them over there. And I think there's a ebb and flow, and we're going to have to be cognizant of where we are on that ebb and that flow. And I think it's important that we study this more.
Well, I have a unique perspective because it's my dang neighborhood. So if we're going to do this, let's not have the 4th of July fireworks. It scares the bejeepers out of my dog, and so I'm saying it lights up the night. I mean, I can't sleep when, and my dog has PSTD.
Yes.
And you don't want to know what my acronym for that is.
Okay, let's poll the council and move on, Mayor. What do you say?
So what do we, I'm listening. We've got great debate going on. What's your desire? Moratorium on all?
Yeah, that's where I'm at.
That's where I'm at.
Okay, I got 2 for that. Roger?
Where I am.
3 for that. I think part of the moratorium, we obviously need some clarification of what exactly we have.
What did this agenda item say? Guidance.
Guidance, and so it sounds to me like I've got the majority of the council up here that is in favor of a moratorium for all signs, but I also am hearing that we would really like to know how the process can be clarified so that we don't have people wasting their time and money and also hurting commerce and things like that. And so
Not all signs, just large off-premise signs. Right?
Billboards.
So you'll legally do that? You will legally do the moratorium?
Off premises, what does that mean? It's not mine?
Off premises is a sign that is...
It's synonymous with billboard. I mean, basically what you have is you don't have...
Well,
You're not advertising your grocery
okay,
store.
but again, I don't think an electronic sign is a billboard, okay?
You're giving an off-premise message.
It is. And exactly. The thing is an off-premise sign is advertising businesses that are not on premise of the sign.
Okay, so what's his name, Sanju, okay? I fly with him all the time, and I never, but okay, so let's say that he puts the Thai restaurant, which I'm assuming sits in their back part, is that then an on-premises sign?
It's an on-premise sign and it's illegal.
Oh, that's illegal?
Because we control the signage in a different part of the code regarding on-premise signs. That's a different part.
Right, they have a certain amount of signage that they're allowed per per street
Okay,
frontage
but
and all that
again,
stuff.
I'm okay with the moratorium for clarification, but I can't support it if we do it, if we penalize something that met all the criteria. I go home feeling like I've just thrown the law out the window because somebody didn't like, So if I got enough people on a speeding ticket that didn't mind me going and wanted to appeal it, we throw it out? I don't know. See what I'm saying? It's just, I get frustrated because we sit and pick and choose based on the resistance, or we overturn our police officers based on that because of.
Well, ultimately, the council has a discretion. The council that's what you're empowered to do as members of the city council, you have that power. That's what's vested in you by state law and by municipal code.
Right. But then why don't we just do away with all these laws and address it on an individual basis?
We only have to have like one meeting every month and a half. I'm in for that.
You would be here 24/7. Yeah.
So let me give the guidance that I'm hearing.
I think we're just unduly punishing this individual prior to going through the notice process for the moratorium and clarification. That's my concern.
So what I'm hearing, the guidance that I'm hearing right now is there's an interest in having a moratorium for all billboards. And part of that moratorium is we would like clarification so that we know and understand the ordinance better than we do now. And maybe there is no change. Maybe there is a change. We don't know. But after 180 days, we should know a lot more about what the sign code is and what if you can or can't have them, and if we want them or if we don't want them, and we should have plenty of input. So the direction would be for you to follow the rules, to notice it, and all of that stuff that you need to do so that we can be educated, so we can help educate the public and on all of that. There is a process, is there not a process, before that moratorium? When would the moratorium go into effect?
Well, it would have to be in writing. What I would propose is that if you want it next council meeting or the first meeting in May, we could have a moratorium prepared and notice it properly.
We're in the middle of May, so it would have to be June.
Thanks, sorry. This is a quick year. But yeah, so we could have it prepared for the first meeting in June. We would do the proper notice. And under the statute, the Idaho Code, it's an abbreviated notice rather than the traditional 2 weeks, the standard.
Is there a reason why we could not do it next week?
That's awful fast.
What is is there a notice period that you have to meet?
No, it's just abbreviated notice. If you were to, you could actually, if we could have it put together, that's the only question is, can we have have the moratorium prepared and ready to meet the timeline for next week's agenda, which is noon today.
The timeline is in a minute and a half.
Yes, sir.
I think it's been fun watching Frank's expressions. I think it'll be really interesting to hear testimony from the practitioners.
Yes.
So we're really looking at June so that you've got the time to get it done. Is that what I'm hearing?
Yes, that would be fine.
The first meeting in
June.
Do we have to have a public hearing?
Yes.
For a moratorium?
Yes. After hearing, the statute says hearing. I'm going to assume that it's a hearing.
Okay, staff, I have a question. Do you think there's any possible way in the world that we're going to be able to draft enough verbiage when we get to the end of this that we will still not be faced with these same type of situations, short of ban?
I think so. Working with legal, I think we can, and we can look at what other municipalities have done.
And I think you'd be surprised how many, if we need
don't use Coeur d'Alene.
You'd be surprised how many people in this town would like to see us not have billboards.
Well, and that be the case then.
But I want to clarify, the process goes as it goes. You will always have the opportunity as a city council. You may, at any time after you rewrite a sign ordinance, you may have somebody standing in front of you asking you for an exception to that ordinance, because that's
That is your function.
That is the function
That's
of the
our
council.
function. That's
So
what it is.
even
So
if we
you're
had
not
a
going to
total ban,
prevent.
they could appeal if we were to approve
They could ask, yes, they could ask for an exception. It would be up to the council's wisdoms and inclination as to whether they grant an exception to the ban.
So regardless of how you draft it, you still have the ability to hear that and make a decision to
Yes, sir.
follow
Then
the
we just
ordinance
will
or
leave it
not.
like it is and discuss it on it.
Okay, so if you would do that, then I would like another clarification for Councilman Orr and Johnston. Both have a concern. Is there a way if that the council has that the council could reconsider Sanju's application before a moratorium is put into action in the 1st of June?
Yes, the council could if
I would have had to have been on the prevailing side of the vote for it to be reconsidered.
So, well, that's what I want to hear.
yes.
Legal,
District court.
legal,
Make the motion.
what is your opinion on that?
If there was a motion, if the prevailing side were to make a motion to reconsider the decision that was handed down Thursday night, yes, it could be reheard and reconsidered. Sanju also has the ability under Idaho Code to petition for judicial review of the council decision as well as ask for a regulatory taking analysis. So there are other avenues for him to proceed, but it would be, from my perspective, if there was someone that was on the prevailing side, made a motion to reconsider, then vote taken, then yes, that would be legal.
So who was on the prevailing side?
So if he,
4 people, there were 2 against and 4 in favor. So one of the
so
me?
you and Heidi and Roger and Steve.
Okay.
One of you 4 would have to make a motion for that to come back.
Okay.
As I understand it, is that correct?
That is correct, Mayor.
So it'd have to be Steve.
So, would the
I'm just
second,
saying, let's sit up here and say something that, that's just the way it is. I mean, we're going to have this discussion, let's have it.
so the second, if he was to make one, would the second have to be by the prevailing side as well, or no?
No, any member.
Anybody could. Okay.
All right. May
So I think you got your marching orders.
Yes, sir. May we be excused?
Absolutely.
Thank you.
Get in there and write that.
Thanks,
I have to
Terry.
go to court.
Thanks, Richard.
Thank you.
You're welcome.
Melanie, Matt, thank you.
All right, then we'll move on to agenda item 9, stormwater funding update. Staff will be present to discuss possible avenues for funding to support city costs related to the installation, operation, and maintenance of stormwater facilities for new and existing development on public-private land.
Afternoon, Council. So Hannah Sanger with the Science and Environment Division, and here to talk about funding for stormwater. About 2 months ago at a study session, you asked staff to look more into options for funding for stormwater, thinking about some of our maintenance costs, particularly with ponds. So we started this process and wanted to actually have this presentation is going to really focus on a more philosophical level of who should pay for the services that staff provide related to stormwater. There's stormwater engineering, design, review, and inspections. There's operations and maintenance we do. There's capital improvement projects and permit management. And so I'm going to focus on mostly those top 2 today. And I imagine this is going to be a long conversation over a number of months where we go, so the others would get incorporated over time. So land use affects runoff and infiltration. And so I have here, just to sort of prime your thinking, it's been Water Week all week, so I've been hanging out with 3rd graders at the water shop. Hopefully, if you didn't come this year, you've been sometime in the past.
Well, if you've been hanging out with 3rd graders, you're with the right crowd to win.
Oh, they're so cool. They're like the funnest ever. And so this is a little experiment that the NRCS has, and they have a dish of soil that's conventionally tilled and a dish of soil that is not tilled, so it has some dead grasses in it. And you pour water equally on top of both of them and watch it. And you'll notice the one on the left, the conventionally tilled stuff, it all runs off and it's dirty. And this one, the no-till, it nicely infiltrates and you don't really see anything here, and there's clean water back there. So just, we don't we don't have much agriculture in the city, but we do have streets where the water will run off and take whatever's on the street into our storm drain system. So this is the issue we're dealing with stormwater. And so then to further prime you, oops, sorry. Let's see if I can get here. Hopefully we're connected to the internet. I might have forgotten. Okay, there's no sound. Oops, it's not working with yours, but it's
I know where the ring goes.
It's working with mine. Sorry, I don't know why.
I think you got a dot between you and the B.
I got what?
A dot between your tu.be. I think that might make your link not.
But it's working here.
You're also in presenter view, which has a hard time connecting between the two.
Oh, okay. Never mind. Oh, there we go. So we'll go back. Sorry. So the music goes just do 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 the whole time. So.
So are you going to do that for us?
I've been taking singing lessons. So it's only about a minute long. So this whole video is in England, but I think it applies anywhere in the world. I'm not going to talk about this acronym, so just ignore that. That's theirs. And these are some of the stormwater features that we are installing and everybody across the globe is installing to deal with this dirty runoff. And I'm showing this now so that if you hear these words and we have some similar visuals in mind of and so this is kind of what we did on MLK. A lot of commercial areas in Pocatello are doing similar things. We don't have green roofs, but we have a lot of underground storage. We have a lot of bioretention. We don't have much permeable paving. We have a lot of swales and basins. We don't have swans. So one of the things about stormwater is it really connects with many aspects of development. Let's see if we get here. And you as a council, that is a beautiful image of what you can do with stormwater. We can put in ponds, ponds and swales and have permeable paving and have development come. And that's an awesome vision. And then we have reality. We have the reality that these things can be expensive, they're challenging to do. We have the reality here that our stormwater is really gross right now. And so that is your challenge, is the council members, is taking this vision of where we want to go and dealing with the reality that we have and the reality that it's challenging to realize our vision. So again, stormwater, looking here for council direction and acting on it. So recently, Streets got 2 new staff for stormwater operations and maintenance. That's fabulous. Engineering Public Works is going through a reorganization, so there's opportunities there. And we're getting a new stormwater permit, and that will affect where we go as well. And all of that is really influenced by the direction of this council, how we input, how we do the permit, how engineering staff do stormwater, how street staff do stormwater. Your direction is going to guide a lot of that. So what do we have for visions? We have comprehensive plan, which talks about water quality, groundwater, surface water, manage stormwater runoff, protect water quality, minimize shallow flooding, provide safe potable water. And then we recently passed a Portneuf River vision, restore the Portneuf River corridor in order to revitalize environmental, recreational, economic opportunities while increasing community pride, connectivity, and quality of life. Recently, this is what you adopted and saying this is where we want to go. And so looking today for sort of affirmation that this is where you do want to go with stormwater, and then there's who pays. And so that's ultimately some questions. In terms of enacting this vision, that's the services we provide as a city. There's plan and policy development and oversight, so we have manuals and ordinances. We just did one with signs and billboards. There's a permit we've approved. And then we implement these policies and plans, right? So this is a lovely picture of some stormwater runoff from a stormwater pond that burst. So we provide services of trying to properly design and construct facilities that are built by private entities on private land and on the city right-of-way. And then these facilities must be operated and maintained forever. And so one of the services we provide is trying to ensure that that does happen, whether we do that operation and maintenance ourselves or we have others do it themselves. So who deals with stormwater? Science and environment, streets, engineering, rest of public works, WPC, water, sanitation, and then planning and parks, and lots of other, actually, city departments, but these are the main players. And then what are we doing? Science and environment is doing permit management. Streets is mainly doing operations and maintenance, and engineering is mainly doing system design and construction. And then there's also concerns about surface water, folks who are dealing with that, groundwater, and land management. And if you are looking at this further, who funds all of these activities today? So permit management is funded by WPC, water, and our co-permittees. The operations and maintenance is primarily funded by taxes, and system construction and design engineering is primarily funded by taxes with some fees. So there's no link right now between what people pay in and the services they receive. I mean, it's kind of, you can see it's all over the board. Stormwater has to compete with other programs we're offering as a city. And it's distributed across many departments. There's nobody in charge of stormwater. I'm in charge of permit management. Streets does operations and maintenance. Engineering's doing the design. So it's all spread out, and we have other obligations. So Alameda Jefferson comes up, stormwater goes to the side. So it's not at the top. There are other priorities that often bump it, and historically have bumped it. So thinking about this funding sources and how it might compare to other operations we do, particularly related to development. So if we look at stormwater and just new subdivision going in, we develop stormwater policies. The building department develops construction policies, or they approve the latest Idaho standards. And that is paid for, that policy development is paid for stormwater by WPC, water, some taxes. On the building side, building department's funded by fees that contractors pay. And they go and build it. And so the developer builds roads, they build ponds and pipes to city standards. They pay that full cost. Contractor builds a house or a shop to city standards, they pay the full price. We don't subsidize that construction. The city inspects those. If it's a pond or a pipe, mostly taxes are used to pay the cost of inspecting the ponds, the pipes, the streets. If it's a building, the contractor pays for city staff to go out and inspect. So it's entirely contractor fees. For operations and maintenance, for a building, you have to maintain your own property. Done. City's out of it, unless there's a code enforcement issue, and then it comes back to you guys. But if it's a stormwater thing, sometimes the property owner maintains it at their own expense, and sometimes the city maintains it at taxpayer expense. But then the city's responsible for inspecting these and making sure that maintenance is happening, and taxpayers pay for that cost along with WPC water a little bit. And then if there's a failure or something, the city will design and repair it using taxes. And so just a different approach that the council has taken towards stormwater and paying for ponds and other engineering costs versus how homes and buildings are constructed.
They're going to have to throw you. Can you historically give us a little refresher course in terms of the stormwater fee that we had a little problem with a few years ago?
Yes. So in 2003, the City Council approved a stormwater utility fee, and it was going to be about $2.50 a month for residences, more for some commercial spaces, industrial. The citizens then passed a referendum to repeal it, and so the City Council said, we're going to repeal it. And this was before I arrived, so I'm slightly less familiar with the details at the time. And then a number of other cities in Idaho have passed stormwater utilities. They have been, most recently, Lewiston's was overturned. Others have repealed theirs. Coeur d'Alene still has one that's working. So that's sort of, and I will talk about stormwater utilities in a little bit, some more. But that's just a brief history of ours. So 2000, 2003, 2004, we had one for a brief 6 months. We returned all the money. Anything else on that? Okay. So funding options for stormwater, there's a number of them. So taxes, it can pay for the cost of, as we do right now, installing stormwater ponds. It can pay for capital expenses. You want a new facility, it can do that. It can pay for operations maintenance. It does all that right now. We can have fees for design review and inspections, similar to what there is for a house being built. So that would pay for that installation review. It's not going to pay for capital costs. You're not going to use it for operations and maintenance. It's a very specific fee. We can have a utility fee. It could possibly be used for installation review. I don't know about the legality there because of the specifics of such a fee, but potentially. It can be used to pay for capital expenses, and it can be used to pay for operations and maintenance. We can have an impact fee. So you put in a new pond. Here's your impact on the system. It's not going to pay for the review costs. It could pay for capital, but it's not going to pay for operations and maintenance. Again, there's a bunch of legal issues associated with impact fees of what it could be paid for and what it couldn't. We can have pond maintenance fees. City will maintain your pond. We'll pay for it. Now, that's not going to cover maintenance of their pipes and street sweeping and catch basins. You can pass a bond. It's kind of the same as taxes. We can try and get grants, but those are generally only for big capital expenses, and they are far and few between. But I will try, and we can, of course, get loans for these big capital projects. So those are the general funding options on the table. I'm going to focus on these top three that have faded out to dark orange on your screen. So looking at taxes, design review inspection fees, and utility fees today, just because there's a lot. So again, Stormwater, when we think about a sustainable system, we think about, we're looking for some environmental benefits. We're dealing with the fact that we have bad water quality that comes off of erodes from our soils. And then thinking about these economic issues, it costs money. We can't get away from the fact that things cost money. It costs money to inspect. It costs money to build ponds. But who pays? And who gets flooded? Who deals with the poor water quality? And who pays will actually impact the kind of systems that are built, what we are actually incentivizing. And so our funding can incentivize certain kinds of stormwater facilities. It can incentivize what city staff focus on as well. So right now our funding is disconnected from the services provided. And so there isn't a link, and we have fewer opportunities for incentives. So again, who pays is where we're going. So I'm going to focus on two parts. First, facility design and construction, and then the operations and maintenance. So how do we build ponds? So again, an improperly designed, constructed facility will flood homes and property and send contaminated water to other stormwater facilities or the Port Neuf River. This is a pond failure right here. It's running through, I think it's Gardino Park. The contractor, the developer, they're going to have to rebuild the pond, but the contaminated water becomes a city's responsibility once it hits our system and it goes into the Port Neuf River, and we are responsible for it. We see it in the water quality measurements in the Port Neuf River. So not only, are we swimming in it and fishing in it, we are getting dinged on our permit for that. And we are saying, hey, we had a violation at this point. Not our fault, but we become responsible. So good facility design by construction and construction by developers requires clear and appropriate city standards. We're in really good shape there. Merrill's about to approve additional standards for public works construction. That should come before you for approval in a couple weeks. You've been reviewing that along the way this winter. Adequate city equipment. We have computers, we have trucks to go and inspect facilities. Adequate city staffing to review plans, inspect facilities during construction, and enforce city standards. Engineering staff is currently being reorganized and has been reduced by about a third. I know it's being reorganized there, but we need to make sure we have appropriate enough city staffing. That is not the focus of this presentation, but it ties into you do have to pay for things somehow. You can subcontract out this work. We can hire inspectors. We can hire a firm, and just like Bannock County does with their surveyors, don't have an in-house surveyor, so you just subcontract it out, and you charge developers whatever that contractor pays you or charges you plus some overhead. So another option. So again, back to funding options here are property taxes. You could have design review and inspection fees. We have some of those, but not much. And you could possibly use utility fees. We currently use taxes with some review and inspection fees. I'm going to recommend design review and inspection fees, but this is a council looking for guidance on where you want to go. So what are design review and inspection fees? Generally, they're based on the cost of public improvements. So 1 to 4% of a public improvement, that becomes your fee. Or it could be the number of plan sheets.
Are we doing that right now? I think we're doing all that right now, aren't we?
No.
Plan review?
Not fully. So I can give you a sheet that shows that. Great question. Based on linear feet or the actual cost. So you could make a down payment and you're going to pay the actual cost. And so your fee has to be based on the services provided. So again, looking at staff time for stormwater. So engineering department is going to spend on design review. If we have a small commercial project, they're going to spend a couple hours on design review and maybe 3 to 4 hours if it's a 14-home residential subdivision. And these numbers are rough, so I'm just trying to give you an estimate. Inspections for a small commercial project for erosion, grading, ponds, pipes, camera, full final locate, 10 to 12 hours. For 14-home residential subdivision, 24 and a half hours on average. And this doesn't include the time they might spend also answering questions before this whole process begins. So, what are we charging? All right, this showed up a little bit weird, but I'll try and work you through it. So of those 30 minutes, our fees are taking about, on erosion and sediment control, of a 14-home residential project. Let's see if I can get this to work. Here we go. 75% of that time we charge a fee for. About 25% of the time we don't. It's taxes pay for it. Grading, our fee covers about 25% of the time that staff spend reviewing a grading plan. Taxpayers pay the rest of that time. Ponds, pipes, and structures, the fee covers 5%, and taxpayers pay 95% of the time spent reviewing ponds, pipes, and structures. When it comes to inspections, the fee for erosion and sediment control covers 75% of staff time. For grading, it covers about 40% of staff time. Taxpayers pay the rest. For ponds, pipes, and structures, 5% fee, 95% for taxes. And camera and final locate, we don't charge a fee, so taxpayers are paying for all of that. So in the end, that means that, our fees we're collecting on this 14-home subdivision is about $450 for the cost that this city spends inspecting it, and taxpayers are paying about $2,000. So we're using that money of taxpayer dollars. So yearly we might have 15 commercial and 10 subdivision. That's going to be about 300 hours. So about 2 months of salary plus overhead. So that's where staff time, and that's the current council direction, or what we're asking for clarification on. Is that how you want this to be paid for? Is primarily taxes, or is it a user fee? And so I'm going to sort of follow up on that with a second slide. Is we have all public improvement. So I couldn't break this out just for stormwater. I did it for sort of all public improvements and looking at where Pocatello is compared to a number of other communities. So we have, and Meryl did a lot of this work.
Right, thanks, Meryl.
Yes. Of trying to understand where we are at and what some other communities are at. So I'm taking a lot of his information, and hopefully I wrote it down correctly. So you have a 4-acre, $450,000, 14-home residential subdivision, 5,000 cubic yards grading. In Pocatello, we'll charge a fee of about $2,000. And in other communities, you can see it ranges from Twin Falls, it's under $1,000 about, to close to $8,000 of cost in fees. A number of communities actually say, hey, we're just going to charge you the actual cost. And so a big question is, does it actually cost the city $6,000 or $8,000? That's not what I want to focus on today. I want to say, what percentage of that do you want to have paid for by the user, the developer, or what percentage should be paid for by taxes? So, and engineering staff will be sort of back when they do their budget to think about that. So again, thinking about this again, we have our vision, and there's services that we provide to developers to make sure that our stormwater facilities are safe, they're built correctly, and those services cost money. It's either paid, it's got to be paid for somehow, and who pays for it. We then, as staff, take, all the money received, and some of that goes to overhead, finance, legal. We have to have lights on, and then some of it would be allocated towards doing inspections and design review. So that's the end game. So today, if possible, looking for guidance on one, thinking about, are you interested in staffing this with city staff or consultants? I'm less really interested in that. But, and two, funding it with design review inspection fees, property taxes, utility fees, percentage of each. Don't need a decision now, but no decision means property tax. You know, your status quo. You don't get out of making a decision is also what I want to say is if you don't make one, you say we want to ignore it, it's property taxes, you know, continuing this system of 75% property taxes. So any questions or?
Okay, and is this the end of your presentation?
No, I have another section about utility fees and I can,
What do
I
you mean
know.
for utility fees?
Holy mackerel.
I know it's long.
No, what about utility fees?
Oh, I talk about giving you some background on utility fees.
Well, I thought we were talking about how do we pay for these after.
Yeah, that's next. But I couldn't.
No, I don't care what you do here.
Okay. I couldn't talk about what you do next without also
I mean,
discussing
I got a
this.
question. I was in Denver earlier this week, and one of the meetings I was in, they were talking about the population of Colorado is being projected to double in the next 20 years. They've got to be very active in their planning because you can't be caught behind. Are we doing our planning out far enough? Because if we had big influx without a plan in place of development, then it'd be all the taxpayers would be subsidizing that development. And I think we got to start having discussion that way because we've got a lot of people that don't really want to subsidize somebody else.
And that's why, even though council didn't direct me to come with this, it's a key part of thinking about the maintenance is that even though this is pennies on the dollar compared to the cost of maintaining it, it's still, right now, it is a significant subsidy that taxpayers are providing. And that might be where you want to go. Some communities go that route, but you should be aware that that is the route that you're currently on. And so, perhaps you just want to hold that thought, and I'll go through this next.
well, I got one thought. 'Cause
Yep.
I really think that for our benefit, okay, I think we ought to have staff and possibly some contractors or developers or something in a study session meeting, and just like we do with a public hearing, kind of let both sides present pros and cons or cases, so that we have some evaluation here, because I get out in the community and I hear all sorts of other things about how, well, we're doing storm water basins not quite correct. There's other cases around the country that seem to be working better, what type of barriers, so on and so forth. And it's always good to have the whole, or what we perceive as a fuller story before we make a decision. I don't know what the council thinks about that, but the rest of the council do. Like I said, I've had quite a bit of feedback. I'm not saying.
And I think you're on to the right track. I do think the balance needs to be, though, that we maybe have from neighborhood organizations, a couple representatives from the static community, so that we hear how they would want to address a growing community, because that's where our dialogue has to happen, is with the people who are there. Do they really want to be engaged in everything across the board, you know?
Well, and one of the discussions we had was about, you know, where we're at right now moving forward. Right now, we've got a hodgepodge of you build the storm containment ponds, and this homeowner association or whatever is going to take care of them. We already know for a fact that doesn't work.
And so that is next.
Well, that should have been done.
So I will go through this next section. I'll try and go through it fast. There's a lot here, I know, and I know that this is going to be numerous follow-ups, but I really wanted just to try and give you some broad overview of all the issues and to try and give you a number of visuals so that we can have meaningful discussions moving forward. So poorly maintained facilities, flood homes, then contaminated water, and it's the city's responsibility. So who maintains what? Sometimes it's private, sometimes it's public. So private development, they generally maintain facilities for private streets, parking lots, their own buildings, and then subdivision retention ponds from some residential subdivisions. The city also does some residential subdivisions. And then we do facilities in the public right-of-way, gutters, pipes, manholes, catch basins, street sweeping. So beyond just ponds, and that's the one thing I want to draw to your attention, there's a lot the city does to maintain the stormwater system that's beyond ponds. So what's involved? There's this pond, swale maintenance, there's pipe, catch basin, head gate maintenance, there's street sweeping, there's flood control, the street department's out, removing debris from storm grates every time it rains. And then if there's a capital improvement project, we need to design and construct those retrofits. So good maintenance and a capital improvement program, the CIP, requires inspecting and enforcing private facility maintenance. So we've barely started this. Our mapping of these is almost complete, and we have a staff member from Science and Environment who's assigned to start working on that. Inspect and maintain public facilities. Significant backlog, but again, mapping is nearly complete, and streets just hired 2 people. So that is awesome, and council approved additional time for street sweeping, so fabulous. Design retrofits to existing public facilities. Backlog, we haven't done some major CIPs for a long time. We keep plugging away at little ones, but there's a backlog, and engineering reorg, we need to sort out, what's feasible with current staffing levels. Adequate city equipment and supplies. We're pretty good. Street sweepers always break, so even though you're there, it doesn't mean the cost is taken care of. There will always be significant costs there for the equipment. So good maintenance depends on staffing, equipment and supplies. And those cost money. And so again, how do we pay for that? Options, taxes, utility fees, impact fees, pond maintenance fees, primarily tax funded right now. Recommend a stormwater utility if council desires. So utility fees, generally they're based on lot size or your impervious area. Generally there's sort of a flat rate for a residential. And then you have a discount for your use of green infrastructure, or if you have additional retention and detention on your site. So if you do a better job of treating stormwater and retaining it, then you get a discount. Because our goal is not to have this massive stormwater fund. Our goal is not to do lots of capital improvement projects. Our goal is to have a swimmable, fishable Port-Neuf River. And that means we send less dirty water to the Port-Neuf River. So we want to incentivize people to help us on that and give them a discounted rate if they can do that. But right now, you can redo your parking lot, and it all sends dirty water to the Port-Neuf River, and you redo it, and it can continue to send dirty water to the Port-Neuf, and there's no ability for us to incentivize somebody to plant a tree and put in a swale. They just have to do it because they really, really want that swale and that tree, and we don't have an incentive for that. And so that is, I think, one of the best benefits with this utility fee is the ability to actually, people who are going to do the right thing, to reward them for that. And the people who are making our community look better, that has a stormwater benefit, let's reward them for that with more than just, hey, we're going to expedite your permit. We'll do it in 5 days instead of 6. That's generally not much of a reward. So, and the fee has to be based on the cost of services provided. We can't charge. So this is a map of the railroad yard right here. And these are some areas where we're looking at some capital improvement projects to deal with Center Street area. But the railroad yard pays no taxes. Railroad yard is a rather large part of Pocatello. So this is the situation we're in right now, is we have this whole downtown area, and we have this railroad yard, pays no taxes, contributes a lot of stormwater to our system. And so who pays, for managing stormwater? So just thinking about where we're at and who is benefiting and who's paying into the system. Where's the budget go of a sample stormwater budget? So looking at a number of cities, so this is just a sort of a guess for Pocatello. Capital improvement projects generally take about 40%. Project managing those, another 4% of your full budget, whatever that is. The engineering and master planning your whole stormwater system, 7%. Operation maintenance, another 40+%. and then the permit management administration, 6%. So you can see that operations and maintenance and capital improvement projects, particularly in this, for us, it would be right down here. That's the bulk of your money. Maintaining those ponds, up on the hills, the pipes, and then figuring out how do we alleviate the problem areas. And so there we are.
So you're saying there's lots of stormwater that comes off the railroad property?
There is. It goes, a lot of it comes right here on west of, in Old Town. It comes off, and then a number of it comes off just south of Benton Street on First Street, by First Street.
Comes off through a piping system?
No,
or just on the surface?
it just sheet flows. During a big rain event, it sheet flows off. The other thing we're looking at is, can we take some city water and send it to the railroad yard at any spot, because they have some land that they could utilize for stormwater that would benefit the city as well.
Have we ever asked them to do anything with their stormwater?
I am in conversations with them about that, and so I'm in the early part of the conversations where we're just talking about options. And so this is step one, is me sending them this map and saying, okay, here's railroad yard, where a stormwater pond would be a huge benefit to the city. So we'll see where those go from here. Any questions on this sort of budget? Okay, city comparisons, stormwater operations and maintenance, looking at mostly in Idaho, Pocatello, so we charged $250 a month. Ogden does this impact fee, so a subdivision pays $1,500 per parcel. So that's a chunk of change, or 65 cents per square foot of impervious area for commercial, industrial. Coeur d'Alene, $4 a month. Bend has one, I didn't write down the price. Billings, $450. Nampa had it for $350, and Lewiston had it for $450. You see them up to $20 a month, and you see them as low as about $2. So that would, what's the appropriate amount for Pocatello would require a long period of study and assessing what we need, what makes sense. But there's a lot of communities are doing this, and so there's a lot of information out there on guidance on how best to do it. And there's a lot of big push that you should give people credits for doing the right thing. You should provide exemptions. You should think about hardship. You should, and there's a lot of avenues for doing that. So, again, who maintains? Our current practice is this mess right over here with the writing that doesn't fit. Commercial industrial development facilities on private property, they do pipes, ponds, manholes, facilities in the right of way, gutters, pipes, manholes, street sweeping, detention, retention ponds and swales from residential subdivisions. Some of them don't connect to the city system. Some of them connect. Some of them have extra landscaping needs because you want it to be extra pretty. And then on residential property, you could have trees, green roofs, dry wells that help the city, but they're on individual private properties for owner spots. So this is a similar one. We provide services. They cost money to maintain this. Who pays? If you do a stormwater facility charge, there's the administration that goes to utility billing, and then you have operation and maintenance, these capital improvement projects, engineering, permit management, etc. So review of these funding options. And your last slide is asking for council guidance on where you want to go with this.
I don't think you're going to get any of that today.
I don't think so. But I wanted to, that is the big overview. I thank you for your patience before lunch.
Here's what I recommend. I recommend that, because I don't think we're going to get any of this done this year with budget and everything else. So what I would recommend, my recommendation would be is that we revisit this with the groups of interest on this, some type of public study session or something with those people right after we finish up the budget process.
That's,
because I think we're pretty
you got
committed
a
for
lot
budget
of,
until what, August?
Yep, and
So
that's,
who would be the stakeholders that we would want to invite to such a meeting, Mike?
Well, I think some of our commercial real estate people who participate in development.
Well, like Rich Kirkham led the charge against this in the past.
Well, I mean,
Then we don't want to invite him.
no, then we want them on the committee. I want everybody's opposed. Figure
Don Zeeby's mentioned some comments about some of the stuff with some of the restaurants and such, with some of that type of basins. I don't know if you can get a railroad representative here. Maybe that's not big.
Well, maybe I have a, we can have a,
Developers, like
Developers that do subdivisions. Because if nothing else, I think we need to get on track that we know that the engineering that's being done on subdivisions and that we know that we're going to end up taking care of or being built to our specs, that we know how we're going to be able to take care of them with the kind of equipment and stuff we buy. We talked about that a little bit. So developers, I think, would be important.
do we have a working HOA that takes care of their own?
not for stormwater. There's some that take care of other,
They're tough.
they mow.
Well, I'm talking about, because again, I thought our real interest here was how are we going to take care and maintain all of these gullies up here with storm
Yes.
retention pond. One question I have, so because I mean, I want to go to lunch too. If we develop a wetland, doesn't that begin to or start to fall under EPA
No,
criteria?
no. I know where you're coming from, but if it's a stormwater facility, it's not under EPA jurisdiction in this situation. So
Just the discharge.
I am very confident there.
Just the discharge when it goes in the river, right?
Then it's part of our stormwater permit, but it's not going to be, we're not going to be under 404, it's not going to be a water of the U.S.
What about the one down First Street?
Not a water of the U.S., it's just a stormwater wetland facility. And EPA has been very clear on that even with the rule that has been held back.
Yeah, just recently.
Yeah, just recently, that rule still would have said First Street wetland is not a water of the U.S. So,
Okay, I'm done. Squirrel.
Okay.
So I'm hearing
Any other
guidance.
questions?
Yeah, I still would have some regular people from residential areas be part of this.
Okay.
You know, because what comes off the hill gets into these neighborhoods. When Center Street developed, there's one of the big runoffs. All of us in the college neighborhood there had to wash our streets, our sidewalks up to our houses and our places because of the mud that was in the water. And, big discharge. So, everybody's impacted, so we ought to have a few people to articulate that.
And maybe what we need is an ad hoc committee that can come together and present and
Get the conversation started.
But if you want to go down this path, that's really, if you want to go down this path, I'll jump into it, but I want to make sure you're all on board because it's not an easy topic. And
I think it's real important to say that the chance of getting a stormwater utility fee is pretty remote.
Between slim and none.
There are 3 repeals on here on your list. But I do think it's important for us to educate our community of what the costs they're bearing because we're required to do stormwater management.
I think Logan could write an article on that and get it published that'd help us a lot.
we can go that route. So yes, we can.
Cleaning your water so it's easier to swallow.
That is terrible.
Okay, so we'll have some discussion. We'll kind of try to find a good group of people that maybe we could put in an ad hoc committee and have a discussion. The ad hoc committee may be a short-lived thing, and we may just go back to what we're doing now, and it may not be, but it sounds like a presentation for the city council after budget season, so September-ish, October sometime.
So related to that, essentially keep current funding allocations for now.
Yes, that's what I'm hearing. Don't think we can get it changed quick enough at this point.
That's fine. Makes it easier.
Yeah, we got plenty of dental staff.
Good. Sounds good. Thank you very much. Sounds like we've got a desire to break for lunch.
Yeah, right, same.
is here, so after lunch, we will jump into agenda item number 10, the Great Idaho Eclipse. I was thinking of
One way we can say.
Good afternoon, and thank you for joining us for our City Council study session after the lunch break. We will go ahead and get started. We're going to jump number 10, and we'll go to number 11, and maybe we'll be back to item number 10 as soon as we're done with that. But item number 11 is use of capital contingency funds to purchase fire equipment. Fire department staff will be present to seek council's guidance regarding the use of capital contingency funds in the amount of $42,025 to purchase a vehicle to replace the Assistant Chief Public Safety vehicle. Tom, how are you?
Tom Sanford, Assistant Chief, Pocatello Fire. I did want to make a clarification on the request. The request is for existing 2017 fiscal year capital funds versus how we first started off with this.
So, Tom, I want to clarify, this is a capital funds that are already in the police department or the fire department budget. It's not the capital funds that
have been set aside
that have been aside for anything else. Okay.
Correct. So what we have is a 2001 Tahoe. I was hoping that Councilman Moore would say, yes, I remember buying that, but this was bought right after he retired. And so, it's kind of old.
He just got rid of one.
Thanks.
He just got rid of one that was just a couple years newer, didn't he?
That's right.
So, and this vehicle has had many owners, been used a lot. It has 135,000+ miles on it. And there are things that are starting to fall apart on it, like I have tape holding the shroud to the steering column together because it had broken. Door doesn't seal anymore, so it whistles down the highway. And
So how are you going to cover the cost?
okay, so out of capital funds, which we have not spent all, I have, using state bidding process, I have found a Suburban for $42,066.25. I have a bid to detail it so it looks similar to the other fire department rigs. And this rig, if purchased, will replace mine because mine will be removed and probably auctioned next year. And then I will get the battalion chief's rig, which is a 2013 Tahoe. The benefit to that is our battalion chiefs now are covering more of the calls and need more equipment, and the Suburban will give them an extra 1.5 feet in which to put their gear and stuff in. So we're trying to do 2 birds with 1 stone by doing this.
And you're doing that out of current capital money that you have in your budget right now?
Yes, I was hoping that Joyce would be able to validate that, but from what we've seen recently, it is available.
So I have a question. Are you talking about a 2017 Suburban?
Yes.
What's the difference between a Suburban and a Tahoe?
About 1.5 foot, longer wheelbase.
A little longer.
Tahoe's on a pickup wheelbase, and so.
And the other one's a truck wheelbase.
Yeah.
Right.
The reason I ask is I was looking for the email that I had received that in order to get the 2017 state bid, you have to order it by the 25th of this month.
That's correct. That was on my next list here. We are under a deadline. In fact, last year when Chief Gates wanted to do it, we had missed the deadline. So,
and now the problem is the deadline again, Hoss.
Okay.
Hence why I have my name on the council session for the 18th upon whatever the results are.
This is to replace your vehicle, and you couldn't find somebody else to come back for this for you, huh?
I think
it's okay with me as long as they got the money in the budget to do it.
Joyce, do you have the money in the budget?
They have a fire capital fund account that has about $47,000 in it, and so that would be the monies. It will require a budget amendment for us to be able to utilize those monies to expend, so.
Can we ratify it after the fact like we typically often do?
If that's already in there, why does it take a budget amendment?
Because it's over $25,000.
Because we didn't create budget authority in that Fund 75 to expend the monies, and so you need the authority.
Well, as I understand it, we shouldn't have to ratify it because you can order it and we
won't
can just
expend.
approve. We won't expend the money until for another 6 to 8 weeks, and so we can get it approved in June. for
Right.
that matter.
The actual expenditure will take place well after you've adopted it through the budget amendments.
Okay.
Okay.
Let's do it.
Sounds like you've got support on it. I would reach out and, never mind.
No.
You've done it.
Gates just stepped in.
You've done it. You're in good shape.
I just wanted to be here. No.
Yes, we have already purchased the other equipment necessary to fully outfit it.
Okay.
So at this point, just basically the 42,666 is what we're looking at to get this operational.
Okay, perfect. Let's get it done.
How much does the other equipment cost?
About $15,000. I can tell you the radios itself cost a fair amount of money, just the radios.
Get it
We're
on
thinking about moving away from radio.
amendment.
Yes, I'll add it too. Actually, I'm trying to wrap up the amendments this week.
Well, no, we
To
got
get out to everyone
do
and all.
chip technology.
Get it on if you'll get it on the amendments and
This is yours.
so that we can get that, do the amendment on it and we'll go from there. And then we'll Ruth will have to remember to put it on the 1st of June. I think it's too late to get it on next week's agenda.
Well,
actually, I put it.
He has his vehicle on the 18th.
Okay.
With the hopes that council would approve it. If not, then I was just going to.
Okay,
Yeah,
then we'll hear it next week.
The amendment process, this is how it will roll through in June. I'm going to get it published by I believe it's the 8th is the study session. I'll bring the amendments to you then, and then on the second meeting of the month, that's when we'll have the public hearing and adoption of the ordinance. Okay?
Okay, sounds good. Thank you.
Thank you.
Yep. Then we were going to... We're going to bounce back up to agenda item number 10, the 2017 Great Idaho Eclipse Planning and Delegation of Authority Update. Police and Fire Department staff will be present to review with council items related to the Great Idaho Eclipse, such as response expectations, concerns, and plans, both locally and regionally. The items are A, increased staffing leading up to and during the eclipse event, August 20th through the 22nd, 2017, and B, desire to participate in a regional planning effort to provide and or receive assistance from signatory jurisdiction subject or should a jurisdiction experience a situation during the eclipse that it overwhelms their local resources. Thanks for making that as easy as possible and as long as you possibly could for the Great Idaho Eclipse. Chief.
Mayor, Council, Chief Gates.
Deputy Chief Peterson.
Public Information Officer and Video Services Director Logan McDougall.
Well, good afternoon. I'm glad I didn't delay your lunch. I was really worried that I was going to be up right before your lunch, and this was going to have to be really fast. Just want to give you a little background. How many of you are aware of the eclipse? I'm sure you've heard of it. So August 21st at about 11:30 in the morning, we're going to have a pretty cool event. The nation, it is actually called the Great American Eclipse because it actually spans the entire continental United States. And it's a pretty cool thing. It's been referred to as a pilgrimage or a once-in-a-lifetime opportunity. And for better or for worse, Idaho in our region is actually considered to be one of the #1 viewing spots in the entire nation due to the probability of low cloud cover. So we've become a focal point. Basically, what they call totality is the place where you'll actually be in totality. It'll be like going from day to night in that span of time. Spans from about Shelley to DuBois, or from halfway between DuBois and the border up in Montana. So that area that's about 90 miles wide is where you can achieve totality, and that's what people seem to be drawn to. To give a little more experience on this, all the hotels, lodgings, and campground in the area or in the region are sold out.
I still have places for rent.
Do you? As are porta potties. They're very difficult to find right now, but they can't even find porta potties for these. Flights have been sold out for quite a while, and what they're saying is Jackson Hole's hotels have been sold out for 3 years, and they're 90% foreign nationals. They're expecting a huge foreign national influx. This is a big deal. I can tell you that the BLM has rented the Manan Butte to an English tour company, and it's an exclusive right. Nobody else, it's no longer public land for the duration of this event. It's worldwide media recognition, and jurisdictions are modifying ordinances to allow for Airbnb, for people who are renting out their backyards for very good fees. Farmers are renting out their lands to camp on, and so it's anticipated to be pretty big. I think that knowing that we are the I-15 corridor that connects us to millions of people all the way from Southern California. And I think that the interesting thing is, as we rolled into this planning process, which has started several months ago, at least on our spectrum, the estimates of who will come or how many will come really range from 50,000 to the number I've heard is 3 million. And in my opinion, that's kind of like planning for a 2.0 earthquake or Yellowstone blowing up. I'm not really sure how we're going to plan for all that, but that's kind of the thing that we're faced. So some of the concerns, obviously, that we're concerned about is first planning for this broad spectrum of event, and what do we do to at least do the best we can to mitigate or prepare for those things. Traffic congestion is clearly a concern. Talking with Tom Kirkham, I-15 can handle about 90,000 cars a day. Well, if we truly get 1 million people that influx into our area, then we're going to have a problem. So we're looking from everything from simple slowdowns to maybe complete incapacitation of the road infrastructure. Clearly, emergency resources. If we had 100,000 more people, that's doubling or tripling our population. And if we tripled our population, the fact is police calls are going to go up, fire calls are going to go up. Maybe not on an equal ratio amount, but it's going to overburden. There's concern that the hospitality industry would be overloaded, as well as gas stations. If you imagine this many people influxing, restaurants are going to be at capacity, gas stations might be at capacity. There's some statistics out there that say that 10% will go temporarily blind because they improperly look at the sun. They sell special glasses that are like super darkening glasses, kind of like a welder's glasses, to allow you to look at it. But if somebody doesn't use those and looks at the sun, they could be temporarily blinded, kind of like a snow blind. Concerns of law violations, everything from people trespassing on people's property to littering to indecent exposure to potential riots, from people being angry and hot. This is a hot summer day. We're looking at August. We're looking at high heat, low humidity, potentially people being out or having traveled a long distance out into a region to see the event, and then not have enough fuel, not have enough water on board. One of the presentations we went to, a gentleman discussed how he took 45 minutes to get into an area and it took 14 hours to get back out of the same area. So that's the type of stuff that we're kind of facing with. And then I think that, and the other one is, people actually going into some of these areas and maybe causing a wildland fire. You have a whole lot of people out in the middle of an open field that now they have a catalytic converter that starts a fire, and we have a large group of people that are stranded or caught within a fire. And then, to be honest, with this many influx of foreign nationals, potential cultural conflicts of people and as tensions rise. So those are some of the concerns that I think that have been raised. I don't know if there's anything that you would add to that.
No, obviously on the police side, traffic congestion is one of our biggest concerns. And not just on the freeway, but that influx of people in town is going to affect everybody in the community. And so really, and Chief Gates is going to talk about a little bit what some of our plans are, but education is going to be a big factor in that preparation. Is getting our community educated and know what to expect and prepared as well as the first responders. It's going to be incumbent that everybody do that. So.
Yeah. to know what you want to charge in your backyard if you're putting up a tent pole.
He's working on it right now.
Well, I mean, we laugh about that, but I wouldn't be surprised if we didn't have somebody come and ask for an exception to a rule to camp in parks and in yards and things like that. I mean, those things that are something the council ought to be actually
considering that.
Be prepared to
I'm
hear
against
something
it
like
because
that.
I still have a rental.
If it'll balance our budget.
Yeah, I think that obviously this has the potential to be a huge economic boom, but I have to look at it from the emergency responder standpoint, and that's our primary focus today. But clearly, the Chamber of Commerce and those groups are really looking at the economic potential and maximizing that. So some of the actions that have taken is quite a bit of local and regional planning. The city has met with the mayor. We've attended a regional planning meeting. Most of the region is currently planning for traffic plans, communication plans. Let Logan talk a little bit about town hall meetings and outreach.
Yeah, so for outreach, we're thinking in no particular order, town halls and meetings with the different businesses and also the general public on what they can expect when the eclipse happens and in the days before and the days after. So hotels, restaurants, tow truck companies, also convenience stores, anyone who may be impacted by this event in a business sense, we want to reach out to them, and then also to the general public and let them know that you may not be able to really go about your normal weekend routine or your early weekday routine because of the influx of people. So just let people know that this is a possibility of happening. Also, to get news releases out from the city and our preparations and what we plan to be doing when the eclipse happens, and let the traditional media get the word out for us and get it to the people who can attend those town halls and those meetings. And lastly, utilizing the city's social media presence, Twitter, Facebook, Instagram, Nextdoor, and that one is especially nice in the fact that you feed directly into people's email. So they're really going to have to try and not see it if they're signed up for the Nextdoor service. It'll be right there for them. They can understand what's going on, and then also have ways for them to reach out to us and ask questions if they have any.
Perfect. Obviously, we're considering what to do with staffing, and that's always a tough one. As I say, as we're trying to plan for everything from the 50,000 to the 3 million, that's a broad spectrum. So I'm going to talk a little bit about that in just a second. Just some other things that are happening. Public Health is actually staging their mass casualty trailer. They're also doing their own outreach. A lot of communities are doing the outreach. All the hospitals in the region have canceled all procedures, so they want to maximize their capacity for events that might be as a result of this. And then there are also a lot of local and regional planning exercises like mass casualty drills and things like that. At our last meeting, we identified, again, trying to plan for how do we know whether this is the $50,000 problem or the $3 million problem. We talked a lot about maybe actually doing traffic counts on I-15 and really trying to measure what that flow input is and get a kind of a read, because this is the summertime, we'll have a lot of people that are transversing through for Yellowstone anyway, but if we know that 3 weeks prior to the eclipse, traffic patterns are, 10,000 a day, and 2 weeks before the eclipse it's 50,000, and 3 weeks or the Friday before it's 100,000 or right at maximum capacity, we're going to have a better idea of how many people are in the area.
Is the transportation department going to alter what they're doing on the freeways during that week?
So I actually, as part of this program, I went out to that ITD planning meeting. The conversation with ITD was that they planned on having all 4 lanes available, and I had even suggested that they consider running a 1-lane northbound, 3-lane southbound during the egress, because we kind of anticipate a kind of a slower buildup, although I'm going to get a related story of my own. But I think that you are going to have that last minute influx of people that kind of wake up and say, hey, I want to go watch this eclipse. That happened to me. I was 21 years old and had some friends over for the house and saw on the news at 10 o'clock that the space shuttle was landing in Edwards Air Force Base 9 hours away. We all piled in a car and drove. Because I think as you see that 2 week out, you're going to see people that really say, hey, I want to see this. this is kind of a once-in-a-lifetime opportunity. And so I think we really don't know what that will be, but so in that conversation of trying to get everybody out as quickly as possible, get them on the road to minimize, people being stuck in traffic, running out of gas, we suggested the one-lane northbound. They actually said that they would consider doing what they call hurricane evacuation, which would be they would actually open all the lanes for southbound, at least on this side of the totality, and that they would basically do that in that event. And I guess, again, trying to know whether we have the numbers that would warrant that or not is kind of what we're trying to figure out. The last thing is that one of the processes, I'm incident commander of a Type 3 the Region 3 incident management team, and we feel that it's very appropriate as a region to kind of plan regionally to create an incident action plan for the region. This isn't necessarily, and we say delegation of authority, that's just common nomenclature for these teams, but it's basically for this, it's giving authorization for that team to plan and for our departments to provide that team with information to make coordination of effort better should something happen. And the intent, really, that delegation that I would request that you authorize the mayor to sign next week at the council meeting would just authorize that team to start planning, have the information of what the PD is staffing, what the fire is staffing for each of the jurisdictions, and then it does allow, it's actually for the duration of this event, outlined from 8 a.m. August 20th to 8 a.m. August 22nd, it actually allows for a mutual aid response, meaning that anybody signatory to that, if something happens up in Idaho Falls that's massive and they need some extra ambulances, we could help shift some ambulances up there. If something happens down here, they would be able to shift resources down here, if available. It's not an obligation, but if we have resources available, we could shift those around. So kind of creating a bigger pool of resources. So
just curious, how many ambulances do we have in the Pocatello area out of your 5 stations?
We have 3 ambulances that are staffed, and then that would be the next question. And again, I don't know whether you want to provide guidance to how we staff, or if you want to realize that we'll do the best we can to staff the appropriate amount. I could put 7 ambulances on. The additional 4 would be on overtime. So again, I don't want to put all 7 of them on overtime if we have the $50,000 problem, but if we have the $3 million problem, I probably would be saying, yep, we're going to put everything we got on the street and make it available. So,
who's on this team you mentioned?
Well, myself and Chief Hanneman from Idaho Falls are IC. We have one law enforcement officer who's IC, and then that team actually has its common incident command structure. So you have an incident commander, you have a PIO, you have a safety officer, you have a liaison officer, and then you have an operations officer, logistics, finance, and those basically coordinate the whole process. And we're not, again, this delegation of authority gives me no authority over Idaho Falls or the police department or anybody else. It just gives us authority to plan. And that basically, in effect, says that you buy into the concept of us developing a plan. And the plan's really going to be, what do you have available? What do we have available? What does Idaho Falls have available? And then accounting for some of those special events. I know that Sandy Downs is they're going to have a concert. They're having an Eclipse concert. So we're going to add fuel to this fire, but that's something that we need to think about, that if they're going to have an Eclipse concert, and we actually have the night before, well, not the 2 nights before, we have the River Fest. So those are all some added things that in our plan, we want to identify those things and make sure that everybody is on the same page, understands that we have a regional operating picture of what's happening, and that we can kind of feed information through city EOCs or county EOCs and say, here's what's going on, here's what we're seeing. We'd like to provide real-time the numbers as ITD, either ITD or if we can put our own counting system up on the interstate. As we see those real-time numbers coming in, trying to put that information out regionally and have a regional information hub. So
Well, Dave, if we're going to start adding things like concerts and stuff like that, we may as well throw out that ISU's first day is also August 21st. And so we're adding another, I don't know, 20,000 people into our community.
Mr. Mayor, to respond a little bit to that, I actually have spoken with someone high up in ISU, and they are going to postpone starting.
Oh, they are?
Yes.
Okay, because I haven't been able to.
That might even be partially because I reached out to General Ritchie with IOEM and suggested that he strongly encourage ISU to not start, because I think we don't need the extra at all, so.
That's the best news I've heard all day, I think.
So any questions, concerns? Again, it's on the agenda for next week to authorize the mayor to sign the delegation authority and mutual aid agreement. And then any guidance you would offer to law, fire, and probably street department on how to staff or,
Well, I just might add, we've had a few meetings, and we're in the process right now of scheduling the meetings with the folks that Chief Gates just mentioned, tow truck drivers, hotels, restaurants and stuff, to kind of get them prepared and at least have them start thinking forward. We've also in the process of planning some town hall meetings. We want our citizens to be thinking about, gas your vehicles up, fuel them up, not on the Saturday or on Monday the 21st,
Buy
but
extra beer and stay home.
Yeah, stay home, get what you need, and don't add to the problem that we may have. I mean,
I've heard several people say, I'm going to rent my Airbnb home out, or my home out on Airbnb for $2,000 and go to Hawaii.
And so we are in the process of doing and making those meetings and being proactive. We discussed as much as if we have an accident on I-15, where are we going to divert people to and detour them and through town, and how are we going to get them back up there? And so we don't have all those plans in motion right now, but we definitely are preparing for worst case scenario, I think. So
can only plan for.
Nobody's worried about how we're going to pay for this, eh?
Well, yeah, we're all worried about that. But
I hadn't worried about it. I mean, I got an idea.
What's your idea?
I think that we ought to get the benefit of the hotel convention fee during this time. And it's too darn bad that fee's not based on the cost of the room, or is it?
Right now, he was just looking, you can get a room, the ones that are left, for $500.
They're not cheap.
Well, there's one, Snow King Lodge in Jackson has one room left for $1,432 a night. Holiday Inn Express has got one or two rooms for $432 a night. So that's why I was thinking about this convention fee that supposedly was passed to pay for the MEC.
There has been discussion at the state level to provide for some reimbursement for this, but that is super preliminary. I really haven't heard anything about them offering too much.
Can you make the assumption, though, that the biggest problem is going to be up the valley? I mean, wouldn't you assume it's going to be like running water up the valley?
I would absolutely believe that the focal point will be there, and I really think where you're going to have the problems is probably not on the ingress, it'll be on the egress. It'll be at 11:35 or 11:40 when this is over, and everybody goes, okay, we're done, let's go home, and they decide to leave. And
there'll be a vacuum.
And as Tom Kirkham and I talked about, if we have 180,000 vehicles, that's 2 days. That takes 2 days. I-15 will only handle 96,000 vehicles a day. So, the pipe is only so big.
Last week, they had, they're working on I-15, and we had to take somebody to Idaho Falls to the airport on Friday evening, and we allowed ourselves plenty of time, but they had it up by Fort Hall. They had it just narrowed down to one lane. It wasn't closed, narrowed down to one lane. It took us 45 minutes to get to Fort Hall. It was backed up almost to Pocatello. It was amazing.
My assistant chief out of Idaho, Pocatello.
Yeah, it was amazing. is backed up that far.
86 was wide open to the airport out there. You should have flown out of there.
I didn't buy the plane ticket.
I know, I heard what you said.
Any questions?
That's all we can tell you.
Okay, well, I think what's important is make sure that we, with our meetings, once we get our plans rolling out and everything, we'll just keep the council informed and of what the plan is and what we're doing. But paying for it is an issue, and regardless, my thought is regardless if the state throws some money out there or not, it's not going to be used in Pocatello. They're going to probably put it up in the north Idaho Falls area, Rexburg, and those areas that are.
Well, you got to get. I think I mean, and I think it's necessary to plan, and I think it's a good thing to do. So that part I'm not concerned about, but Yellowstone Park is sold out. I mean,
the Manan Butte sold out for crying out loud.
because you can sell out and drive that 2 hours to get to that epicenter line. I mean, my property up there is right on the center line, and I've got people calling me, and I've never advertised, so it's goofy what's going on. I don't fully understand it, but I guess it's like I say, it's a once in a lifetime. And I mean, for those of us who remember Woodstock.
Well, and Burning Man is going on a week after, if I'm not. The Burning Man is going on a week after, and I hear that, and I'm glad I don't live up in this area, but there is a gentleman who is offering tours to the top of Bora, so you can witness the eclipse from the top of Bora.
See, Mackey's in that. Mackey,
yeah, they're in that.
Yeah. And so, but that's the issue is I-15. Whether you come out of the park through Jackson, you're going south, you're going to come through either southeast Idaho or northern Utah. So.
Yeah, we're the hub. And like I said, I think what you're seeing is this is really the place that people are gravitating towards because of the probability of viewing it. If I'm going to fly from Denmark to America to watch an eclipse, I want my best probability, and that's why they're coming here.
Plus you can see the park here while you're here too.
And actually, in a way, that's almost hopefully that would be a benefit. If people are actually going to come in and stay, then they're not leaving all at once. And then we only have that rapid influx that we're worried about. I mean, we've talked about all the hotels in Pocatello are sold out. There are 1,500 hotel rooms, 2 people per hotel. Well, that's only 3,000 people. But I don't think that's the primary focus or the concern. It's just that group of people.
No, we live in a state with a lot of public ground.
Yeah.
It's going to stink if we have one of those August rainstorms that we've had the last few years on the 21st. Then it's going to be a hard time getting people out, and they're going to be mad because they didn't get to see anything anyway. So.
Well, there are some thoughts that some people will actually try and chase it and stay within the shadow for a longer period of time.
Good luck with that.
Yeah, if you understand the rate of speed that the sun.
Good week for some of us to be gone somewhere else.
That's right.
I wish that could be me.
Sounds good. Thank you. Then we will move now on to agenda item 12, proposed format change to City Council regular meeting agenda. Removal of standing agenda item from the City Council's regular council meeting format has been proposed. Remove discussion items from the agenda. Council has requested removal of the agenda item to simplify the meeting.
Okay.
Council, any discussion? Do we want to have any discussion on that?
There's so few people that offend it. Is there not a way in which we could still keep it as a part of our regular agenda, but
just go down through the list and pick who we want to hear and who we don't?
Absolutely. That's the way to
That's where we get.
Well, I think that
I know we can't.
I think the issue is, and the question that I would have is there a way to prevent somebody from saying the same thing over and over and over again every 2 weeks? Or is there rules there? And I don't know the answer to that.
Maybe if he got elected to something,
he'll still come.
My concern is because we've got a couple of bad eggs that we really don't want to hear from, that somebody could live out there and have a legitimate thing they want to come bring before the council for a couple of minutes.
And we have had those.
We're not going to let them do that because of Idaho Lower Axe or somebody like that. And so I think we need to look at ways to regulate what he's able to bring before us, whether it's on target or not on target. And if he can't stay on target, then not allow him to speak before us. But I hate because of him or a couple of people to take that ability away from everybody. And I've thought about it a lot. I would hate to see us do that.
Couldn't they still call us, email us, ask to get on a...
Well, they can. I think that there are, there's been times on the years that I've been on the council that it's been really important for somebody to come before the council and bring an issue and talk to us. And I just think to take that away because we have a problem with Idaho, I just don't think it's the right thing to do.
A lot of cities across Idaho have had this same dilemma, and they've just said, let's get rid of it. And they've done that.
So my concern is to that very point. Twin Falls had it and decided to get rid of it because they had a couple people. And when they finally moved to get rid of it, they had an entire community show up to complain about it that had never been there before. And then they got beat up and dragged through the mud for a month or two in the paper, and so they brought it back. And then they got beat up for bringing it back, so they got rid of it again, and they got beat up for doing that. And so if it's something that we're going to do, then it's something just know that we're probably going to get beat up for it, but we got to take the beating and
Jim and I have already been through it.
Could we have a hearing and ask people to come and tell us their opinion on if it's important to them or not? And if no one shows up, then...
I have to tell you, the comments that I've heard over the years from people who watch us on Channel 12 are really admire us for listening to the people we listen to. I've really never heard anybody complain about it. I've heard people say, you know what? You folks are awesome for listening to that.
I've had that same experience, actually.
And it's only 15 minutes.
Exactly.
There are some things that have taken place today that took longer than 15 minutes.
Exactly.
But the other side of it is...
Not you. Not you.
I've heard the converse of that. If I were a business person staying in town and I turned on the station and I caught that, would I think Pocatello is a place to live? And I think that's a fair criticism because that's the face of our community and they're derogatory towards our community.
I hate to take something away from everybody else because of one bad egg. That's how I...
But it's not used that much. And I think...
Okay, let's vote. Move on.
We can't vote.
We can't vote, but we can, unless everybody's...
Mayor, I'm willing to continue the process because it never upsets me.
You can tell that last Thursday night. I could tell that was the case.
He's only got 7 more months of it, too.
I would be in favor of not having it anymore.
Okay, so we got 1 for and 1 against.
I don't want to do it anymore.
2 against.
I'd leave it.
2 for.
It's up to you, Michael.
I abstain.
So the mayor has to vote.
No, you can't abstain.
No, he can't. He won't.
It's the right of the public to be able to express their elected officials in a public forum. I think when you, this is one of these areas when you start to limit the ability of the few to exercise their right, I think we start treading on dangerous ground. So I would keep it.
And my concern is if you eliminated it, then that it really truly shows the appearance. I mean, I don't like it any more than anybody else likes sitting up here and listening, because in August, at the end of August, we're going to have another person here telling us about why the sun went dark on the 21st, because she's no longer trespassed at August 24th. I know that date because it's an anniversary. And so she'll be back, but...
We always have that ability if things get too bad that we can do that. So.
Well, we do have that ability, and so...
We've got some big police officers. They can
That's right, exactly. Okay.
So I think that it sounds like right now we're going to go ahead and keep it on the agenda, and then we'll move from there. We'll see what happens, and if we need to talk about it again, we'll bring it back up and move again.
And still have it as the last item?
Yeah, I think the last item's the best place for it because we can stop it and end the meeting, and they can stand there and talk all day long if they want after we leave.
Then if we're not going to do away with it, we've got to find a way of limiting how often people can speak. I don't think we have to let them speak every time.
Or at least the content of what they're speaking. They can't continue to repeat the same thing over and over again. I'll work with our legal department and find out what we've got there and if there's the ability to do that.
I think it could be a lot worse.
Yeah, I think it could be too. I agree with that. So, okay. Then that's the way we will proceed with that. So, okay. Thank you very much. With that, we will end this meeting. Then we're just going to roll into a budget meeting. We've got about a half hour is all we have, it sounds like.
You're going to need a lot more than half an hour.
A lot less than half?
We just want the chief to run through it because he won't talk like you two.
Well, what we can do is take
I'm trying to change my appointment,
what's on this
Mayor.
schedule and move it into the 25th. It'll make a longer day. It'll be a full day of meetings, but we can try and do that. I know how many slides they have. I think it'd be difficult to get through those in 30 minutes and allow you any questions at all. And with that, I wouldn't want to start it and not be able to finish it.
I agree with that.
I would prefer to have it on the 25th. I'm the guilty party here. I've got to be gone by 10 to 3.
So I'll redo the schedule and re-facilitate that and get it out to everybody for the 25th. And if I have to move one of them to the 1st, I can do that as well. I can fill them in between those two dates so that we can complete on the 1st all the presentations.
So we'll look at doing the budget presentations on the 25th, and it will just we'll just continue to go through.
Right. I'll have to see what the timeline again, and if I need to move one of the presentations for what we have to do on the 25th to the 1st to facilitate all of them, I'll just rework the schedule so that we can. But we'll still complete by the 1st and go into revenue forecast on the 1st. So we'll be on schedule then.
No meeting next week. So, okay.
Is that okay?
That sounds good.
Next week.
Okay.
No, next week we have an evening meeting.
Next week we have an evening meeting, but we don't have a budget presentation next week.
DC 2 days early.
We won't have, Joyce won't be here next week. And so it'll be that her son's graduating from law school. And
Yeah, I have a graduation to
she feels like she ought to be there.
Sorry.
Yeah. We think it's narrow-minded of her, but it is what it is. So, okay.
Any adjourns, sir?
Then with that, then we will adjourn our meeting then now, and we'll have our budget meeting on the 25th.
Okay.
Are you gone all day on the 18th? Or?
Thank you.
I will be here on the